right, good evening, everybody. Thank you for your interest and attendance at tonight's school board meeting. The policy and practices of the WG School Board is to encourage discussion by citizens of subjects related to the management of the school district at our board meetings. The board has provided specific time on the agenda as part of listening to public communication, delegations, and petitions. And we just politely ask that the audience participation be limited specifically to the portion of the agenda titled Communication from the Public, unless otherwise invited to participate by the board. We will call the meeting to order at 6:01 p.m. Can I get a roll call, please? Yes.
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 Any changes or updates to the agenda?
I'll move that the WG Board of Education approve the agenda for the regular meeting on Monday, July 20th, 2020, as presented.
Second.
A motion by Dave, seconded by Sam. All those in favor?
Aye.
Motion carries. Any questions on the previous minutes? Just need a motion to approve.
I move that the WG Board of Education approve the minutes from the meeting on June 15, 2020 as presented.
Second.
A motion by Tim, seconded by Troy. All those in favor?
Aye.
Aye. Motion carries. All right. Well, it's great to see everybody in person. At this time, we would like to invite any members of the audience to come to the front with comments about items of interest or concern. Please begin your comments by stating your name, and we would just ask if you could limit your comments to around 3 minutes so we can keep the meeting moving in a timely fashion and allow others to speak. And just a quick reminder that Iowa law does prohibit us from discussing specific employees or their job performance. Do you have anybody?
Good evening. So, Christy Bilbery and myself are here as co-presidents of Woodward-Granger Education Association. We're thankful to be able to present to the board and public today.
So this slide right here is just an outline of what we're going to see in our presentation.
Our organization is made up of Woodward-Granger teachers, and we are here to advocate on their behalf in regards to our district's plans for reopening.
Kendra and I created a survey for our members to complete to help us answer some questions and to help give them a voice in the reopening of our schools.
So our first question, as you're looking at this, looks at what model people feel most comfortable with. So when we looked at this, you can see that 53% of our membership agree that some form of a hybrid or a distance learning they would be most comfortable with, while 47% feel that on-site instruction would be best.
Question 2 is about the different safety precautions that should be made available to teachers and students because of the variety of needs and environments at each building. You can see that we did have some consistent results that need to be considered in the district's mitigation plans moving forward. The top 3 precautions suggested were limiting unnecessary adults in the building, face masks and/or shields required for all students and staff, and social distancing of at least 3 to 6 feet.
As you can see from this chart, most of our members want to know the district's plan and their specific building plans by early August in order to know what to expect for the coming school year.
Next question. Most of our members do not feel that the district's plan will affect their return to school. However, there are some individuals who will depend on knowing the specifics of their building's plan so they can make the best decision for themselves and their families.
Next, most of our members feel that safety decisions need to be made at both the district and the building level. WJ feels that these plans need to be made with the voices of district administrators, teachers, and support staff in order to create a clear picture of what school will be like for everyone this year.
So over the past few weeks, WGEA has answered countless emails and phone calls from members about our district's plans for the coming year. Members and non-members are concerned and they're experiencing some stress and anxiety about the coming year. WGEA wants to make sure that the voices of our teachers and support staff will be heard and used to guide all further discussions of building specific plans.
So as you can see, our staff members have a lot of questions about the beginning of the year. Again, They're feeling overwhelmed as our building-specific plans have not yet been shared or discussed with them. We need to make sure that all of these questions are asked and answered in all future plans.
So the last slide are the recommendations that WGEA is asking you to consider as the district continues planning for our schools to reopen. Number one, we strongly recommend that teachers and support staff be included in future planning related to our district's return to learn and mitigation plans, especially when making specific schedules, procedures, and protocols at the building level in order to address specific concerns. Two, we work together with district leadership to add any accommodations and modifications to our current staff handbook addressing the new procedures and protocols for safety that will be expected of and protect staff this school year. Face coverings be required for all students and staff members in our district this fall, except for those with a medical condition or when not recommended by the AAP or CDC. 4, hand sanitizer, cleaning supplies, and PPE be provided by the district for all staff and students. 5, the district and school board guarantee that all coaches and support staff be paid regardless of school closure or season cancellation for the 2021 school year. We just want to thank you for taking the opportunity to look over our information and for allowing us to share this with you. We appreciate your time and we look forward to working with all of you in the coming days and throughout the school year.
Thanks, ladies. I appreciate that. I know we're going to talk about a lot of this stuff in our agenda today, so I don't want it to look like we're not willing to talk about it right now. It's coming up in the agenda, and I think we'll have a pretty robust conversation about the stuff that you brought up today. I'm hopeful that we'll be able to address a lot of those concerns in our conversation today, but I think I can speak for everyone and say we're definitely committed to working with our teachers, working with the union to come up with the best solution for everybody. So thank you for your time and effort that you put into that. I very much appreciate it. What else we got?
I just sent a list of questions to the school board, and I think people said that they were going to be addressed, and so maybe they're just going to be addressed within the conversation as well. But,
Maybe. Cody, do you want to put her on a mic, maybe?
Yeah, she needs to go there.
Do you mind coming up here really quick and we can listen to your questions and then
do
we
you want me
can,
to read all of them, or?
you tell me what you think, what you would like to do.
What was your name again?
Kim Nyborg.
So are you referencing the email that you sent to the board?
Yeah.
Okay, perfect. Matt, I think we will probably address most of the questions.
I actually told Kim that she must have been peeking over my shoulder
Yeah.
as we were putting some things together. To be frank, you're more than welcome to share these questions.
It's up to you. I mean, if
We,
you guys are going to
we have the email. I think a lot of the themes of your questions were around what are we going to do in very specific circumstances, certain situations. I think we will address them in our conversation today. Maybe after we have our conversation, maybe we'll touch base with you and just make sure that we've covered
Should we get
everything
them
that
That'd be
you
great.
have.
That
Does
sounds
that feel
better.
okay?
Yeah, no, that's
Awesome.
fine.
Thanks, Kim.
Yeah, no problem.
Appreciate it.
Suzanne Hager?
Google that.
No, she's not public. She's,
Okay.
So just a couple minutes.
We'll take you in a few.
Maybe Buck and Warren.
And I think ours will probably be kind of along the line of waiting and discussing as well.
Okay.
I don't want to speak for you.
No, that's fine. We'll just have a really thorough conversation in about 10 minutes. I think everybody's got the same thing on their mind, so we'll be sure to make it an interactive conversation at that time. All right. Well, let's jump to Hawk highlights then.
So it was timely. I'm going to have Matt Eichhorn come on up. This is that time of year where we kind of talk about the wrap-up of summer sports, and quite frankly, very timely since some information came out just this weekend as it relates to fall sports. So summer wrap-up, fall kickoff.
You got it. Well, thank you. What a summer it was. I just want to say we as a school district and community did a wonderful job this summer to give our kids a chance to play. I would like to acknowledge Coach Wine and her staff, as well as Coach Evans and his staff, for following the rules that we set in place to a T to give our kids the best shot of starting and finishing the season. So I think they did a wonderful job during this unprecedented year. But I would also like to thank you, the school board, and Dr. Adams for allowing us to have the season, because there were some school districts out there that decided that that wasn't the best. So I appreciate you allowing that and allowing our kids to have that. regardless of what happened this year, it was going to be a success just based off the chance that they got to play. Softball, they finished 6-14. They were regional semifinalists. It was a great positive year for them. We had 20 team members, 10 of which were 8th graders, so one senior. So we have a future that's pretty bright ahead of us. Overall, successful season. I thought they all worked hard. Was out of games, practices. Coach Wyant, since she's been on, has done a wonderful job. When I got here, it wasn't the greatest atmosphere, and she's really started to change the culture and do a good job there. So this year as a conference, we decided not to have an all-conference team just based off of we didn't get to play everybody, so you can't really vote on what you didn't know. So baseball-wise, they finished 18-5-1. I wish I was standing here today saying that we were playing for a chance to go to state tomorrow, but they lost in the district finals the other night 8-3 to Panorama. Very well played game. A bunch of career and season records will be broken once the dust settles on this season and you look at the stat book. It's going to be covered with kids that graduated in 2020. So this 5 years that they were here was a very good year. Again, no all conference. All district, we had 4 first team all district kids and 3 second team. We can't announce those yet because some of our teams are still, some of the conference schools are still playing, so you can't announce any of those names at this point, but I can tell you that we had 4 first team and 3 second team. In the coming weeks, months, I'm going to talk with Luke and bring to you guys about potentially starting a middle school baseball softball program. In talking with our coaches, it's something that is definitely needed. The positions as far as coaches are already negotiated in the Schedule C. My high school coaches have written a letter about what the needs would be, and quite frankly, I think with the way that we're growing, I think it's something that is very strongly needed for our district. So be on the lookout for that.
Baseball and softball?
I'm sorry?
Baseball and softball?
Yep. And most of our conference schools already have it, so we'd be able to fill in a schedule pretty easily.
Nice.
So, and then as far as fall sports, as of right now at 6:13, we are a go for fall sports. But at 6:14, I might get an email, and that might be a no. So we're gonna move forward as if the seasons are going to start. We start camps on the 3rd of August, and then practices for all fall sports will be August 10th. We're supposed to get specific guidelines for each sport from both the boys and the girls next Monday, the 27th. So once those come out, we'll have a better idea of what that is, each season is going to look like. Again, very fluid. We're hoping that we're a go, but we're going to just take it day by day. So, questions?
Thanks to you and your coaches for working so hard for these kids.
Yeah,
You
they
gave
did.
them an experience that they're lucky to have. So.
Yeah, I told the baseball boys the other night, obviously they had big aspirations, and I told them it's a feeling that you never want, but if we didn't have that chance, you wouldn't have that feeling to build upon.
Yeah.
And so hopefully that they use that in life, and the younger ones use that as motivation for next year. So
Absolutely.
thank
Thanks,
you.
Matt.
Thank you.
Appreciate it. Okay. Let's move on to the discussion agenda.
So I'm pleased to introduce Suzanne Hegarty from the Dallas County Public Health. I had an opportunity to sit in a meeting with her, and I learned more really in that hour than all the Zoom meetings combined as we're trying to sort all of this out. So I said, I'm going to make a big ask here. Would you be willing to come to our board meeting and talk a little bit about what the health professionals say? We got a lot of education experts in here, but I've committed to anchoring to what the health professionals say as it relates to this issue. So with no further ado, I told her I didn't expect a presentation. She's here. I know you have some questions, and she's here to kind of answer the questions that we may have. I kind of prompted her a little bit on some of the things we might be thinking. If you could just kind of start up maybe with the role that the Dallas County agency and maybe state agency will play in all of this, and then we'll just kind of go from there.
Good evening. As Matt said, I'm Suzanne Haggerty. I'm the director of the Dallas County Health Department. And I'm here to answer your questions more than anything else, to help you walk through specific scenarios. If you have questions about isolation and quarantine, what happens in specific situations with classrooms, with extracurricular activities. I know that you have questions about masks and social distancing and disinfection, so I can talk to some of those as well. I forgot what you just asked about.
No, you're okay. So let's talk about the partnership that we'll have as a
Sure.
school district in Dallas County.
So the health department will be assisting all the schools in situations in which, if you had a child or a staff member be in your school and became symptomatic, or even if they were asymptomatic and they got tested and the test came back positive, then we would happily speak with everyone who is involved. We would walk them through the isolation for the sick person. So isolation, right now the guidelines just changed today, because as we all know, the guidelines always change. Isolation right now is a 10-day long period. If you are symptomatic, that 10-day count starts on the day that your symptoms started. If you are asymptomatic, that 10-day count starts on the day that you are tested, so the day that the test is actually collected. You go through 10 days and you can return to the world, quote unquote, on day 11. There's a difference between isolation, which is for sick people, and quarantine, which is for people who are exposed to a sick person. Quarantine is 14 days, period. Even if you get tested and you test negative, quarantine is still 14 days. And the reason for that is, if you test negative on day 3 of your quarantine, you can test positive on day 6 or day 9 or even up to day 14. And so if you've been exposed to a confirmed case, we want you to stay home for 14 days. What we're doing there is waiting to see if you develop symptoms. It really doesn't have anything to do with your current state of wellness or sickness. It is just waiting to see if you get sick. And you can test positive at any point through those 14 days. And I think that a lot of people mix isolation and quarantine up, but they are two very different things. What?
Define exposed.
Exposure? Sure.
We were all right there.
So you are exposed if you are within 6 feet of a confirmed positive individual for at least 15 minutes without any personal protective equipment. Okay? There's a difference between personal protective equipment and a fabric mask. So personal protective equipment is what healthcare providers wear. It includes a surgical mask or an N95, a face shield, and in certain situations, those alone are okay. Also, if you're doing certain procedures, you have to have gloves and a gown. A fabric face mask does great to protect other people from you. It does not protect you. So if you are within 6 feet of a person for 15 minutes who is a confirmed positive case and you're wearing a fabric face mask, you will still be asked to quarantine for 14 days because you will still be considered exposed.
So I'm just going to play a what if game.
Yep, absolutely.
What if my husband was exposed to somebody at work?
Yep.
Can I still come to school?
That's correct. So an exposure to an exposure is not considered an exposure. However, because you live in the same household, we would ask you to isolate in your household because he has been exposed. So if you could live in, or if he can live in the basement and while you live on the first floor, we don't want you to share a bathroom. We want the person who has not been exposed to take care of the pets. There's a couple other small things. The bathrooms and sharing of spaces in general. So like, if you're fixing supper for you and the rest of the family and he's been exposed, we would ask that he wait and eat separately or in that basement area for the 10 days or for the 14 days of his quarantine.
Okay.
And the same goes for a positive case. So we had an example. We had a college student who lived in a separate apartment of a household, the basement apartment. The rest of the family lived on the first and second floor. The college student tested positive, but because he had a separate entrance and a completely separate apartment, even though they technically were connected by a stairwell, he didn't go into the other areas of the house and did not expose the other people in the house. So he did his isolation in his apartment. The rest of the family was actually not even placed under quarantine because he did not have any contact with them.
Okay.
And I think that's what this relationship will look like. Hey, Suzanne,
Yeah.
let me tell you a story.
Yep.
You
Because
tell-
I really
you tell
do
me how I
feel
need to
that
respond.
there's so many things that are situation dependent. And unfortunately, I can't stand here and say, yes, I know exactly what the guidelines are going to say, because apparently they're releasing some new ones this week, is what they tell me. I haven't seen them yet. But I have heard that we're supposed to get new guidelines from both the Iowa Department of Public Health and the CDC.
So, kind of disclaimer, everything we're saying today is
Subject
as
to
of right
change,
now.
as
Yeah.
always,
So,
unfortunately.
I think
Because that's
with-
not an easy planning situation.
Right. Well, I think Matt said this, we're all building this plane as we fly it,
Right.
right? We're just trying to figure it out as we go.
Correct.
One of the biggest things I think we'll get questions on, and maybe a hot topic of debate, which I wish it wouldn't be, is around masks.
Yep.
What is Dallas County's recommendation in regard to mask usage?
So masks are a tool, and they are absolutely appropriate in some situations, those situations being when you are not able to socially distance.
Okay.
If you cannot stay 6 feet away from the person next to you, then a mask is the best thing that you can do. Like I said before, that does not guarantee that you would not be asked to go into quarantine. The thing about masks is for them to be 100% effective, they have to be used correctly as well. And that includes wearing them correctly, not touching them, and using appropriate hand hygiene. So masks, like I said, they are a tool, they are not the tool. If you could socially distance your students in every situation, that would be the preferred method. It's not realistic, and I know that.
So you said a couple key things about masks that kind of piqued my attention, right? If they're used appropriately.
Yes.
These people know better than us that children don't always do what you ask them to do.
Correct.
Is there an age recommendation where masks are more risky than not wearing them? Is there a threshold that Dallas County considers with recommending
I don't
masks?
think that I could say that they would be more risky. I think that it's more policing than
Sure.
anything else. Like I said, if you're wearing the point of wearing a fabric mask is to protect other people from you. The
Yeah.
point of wearing that mask is to contain your breath, contain your talking, contain your coughs, contain your sneezes. So if you have people that are pulling them down and talking, then obviously you're not containing. And so it just gets to, I think it'll get to a point possibly where are you spending more time policing about the correct way to wear the mask, or are the kids understanding after the first couple of weeks that, hey, in this situation, we need to wear the mask and this is the way that we need to wear it. So I think there's certainly going to be education necessary to keep it wearing it correctly.
And I think the reason I specifically asked that question is we have a really successful preschool program in our building, where it's a lot of 3 and 4-year-olds. Are you aware of recommendations for children that young?
So the American Academy of Pediatrics guidance does not recommend children that young wear masks.
Okay.
And I think it's more to what I just spoke of with the not being able to wear them correctly than it is that there's any danger or any issue with danger to the child.
What is the age where they start to recommend masks? Did they put you on the spot?
Yeah, and I don't recall exactly. I believe it's somewhere between the first and second grade range.
Okay.
I think a lot of the schools, though, are looking at kindergarten and above, that they will at least try to wear masks when they're indoors. And, you know, this is a plan. Sometimes plans have to change.
Sure, sure.
So I shared with you that American Academy of Pediatric article a few
Yeah.
times, and
Yeah.
I really like how they kind of characterize it as harm and benefit.
Right.
And so what you really have to do is which outweighs the harm or the benefit. And I think what Suzanne is saying as pre-K students, there's more harm. I'm using that term loosely when I say harm than there would be benefit by the integrity of the mask and keeping it on, and Christy redirecting them every 30 seconds. This doesn't go on your head, it goes on your face, and all those kinds of things. And so then I think you do have to evaluate that and say, okay, where's the point? I'm looking at a lot of wonderful teachers in here. They teach routines, and they teach routines well. So it's kind of at what point can we teach that routine and have integrity with the mask? That's kind of where my thought goes.
Yeah. And I think really it comes down to also at that age group, how long do you think they'll be able to leave that mask on as far as messing with it goes? I think in certain, like I said, in certain situations, masks are the only tool that you have. One thing that comes to mind is busing. I think most of the schools that I've talked to are going to require masks on buses, simply because trying to social distance on buses is unrealistic and extraordinarily costly. And then the thing to remember too is, for anyone that's not used to it, wearing a mask for a 6 to 8 hour day is a really long day. So if you have situations where you're asking kids to wear masks for fairly long periods of time, just make sure that you plan in situations where they have a break, where they can socially distance, where they can get some time to take it off and have a breather, and perform proper hand hygiene and take it off correctly. But
Sure.
Suzanne, can you talk a little bit about screening again, harm benefit in terms of, hey, when do we screen, why do we screen, should we screen students, and I'm speaking specifically to temperature.
oh, you mean like for a fever?
Yeah.
Yeah. So CDC actually just changed their guidance today on fevers. So a person that's in isolation up until today had to be fever-free for 72 hours. As of today, it's now 24. And the reason they did that is they're finding that not a lot of people who are COVID positive have fevers. And so they're also changing their guidance on screening. I think they're looking more at asking about symptoms rather than asking specifically about fevers. COVID's been a really interesting disease because the symptom, although it's been classified as a respiratory disease, the symptoms run the gamut. We've dealt with people who have GI tract issues. We've dealt with folks who have bruising issues. There's some fevers, obviously. The two symptoms that they look at as the most prevalent at this time are cough and shortness of breath, which obviously are respiratory ones. But the list of other symptoms is 5 or 6 different things long. One that came out in the middle of like the April-May timeframe is a sudden loss of taste and smell. And that one is gaining in popularity. We're seeing it more and more as we see more quote-unquote healthy people who are now getting COVID. And so I think it's one of those things, I don't know that I would recommend taking temperatures at the door. If you do that, you have to calibrate your thermometer. You have to make sure that it's telling you exactly what you want to know. I think if you're looking at screening, you would be better off to have parents at home, or even if you want to do it at the door, to ask about symptoms. Do you have a new cough? Are you short of breath? do things taste funny? Because, you know, with little kids, you need to phrase it in terms they understand. And not necessarily looking at temperatures anymore.
Any specific questions from?
Does Dallas County have any role in contact tracing if we do have a situation?
We do. So we would be responsible for doing the contact tracing. We would want to work with the school. So let's say that in a second grade classroom, you had a student who mom calls you up, says, hey, student tested positive, and you know before so we get a report from the state about that positive test, and we would call the student's parents to talk about isolation, and then we would ask them if they've been in contact with anyone, that 6 feet, 15-minute rule. And they would say, well, he's a second grader and he goes to Woodward-Granger school. In that situation, then we would probably either call an administrative contact or the school nurse and ask for a list of kids in that classroom, the teacher. I would hope that you would have a seating chart so that we can really gauge that 6 feet of distance. It is possible, and I don't know what the guidelines are going to say yet, it is possible that they're going to come out and say that if you're in a classroom situation and it's been an extended period of time, the entire classroom may be placed under quarantine, or they may stay with whoever was within 6 feet. I want to let you know it could go both ways. I don't know the answer to that yet. But we would be the ones responsible for placing people into isolation and quarantine. That's a local Board of Health responsibility.
Do you have any anticipation of response time?
So that's a really good question. So here's the issue with that. If you have a student that comes to school and you send them away because they're symptomatic, let's say, if I were the school, then I would start gathering that information. You may want to give parents a heads up that we have a symptomatic individual in your classroom. Unfortunately, though, we won't be calling that individual until they test positive, and that test is reported to the state of Iowa. So right now, if you read the news this weekend, they had a whole backlog that didn't get reported for up to 4 or 5 days. Our responsibility to place people into isolation and quarantine doesn't happen until we receive that reported positive test. So there may be a lag, and I don't have a lot of options to fix that.
So, again, I'm playing what-if games.
Yeah?
Let's say my son had symptoms, I had him in school, he got symptoms, I pull him out, I get him tested, he's at home.
Uh-huh.
2 days later, 3 days later, I get the test results at 10 o'clock in the morning. I call Matt and say, Matt, Lucas tested positive. What does he do with the kids right there? Do they finish the day? Do they go home? Do we
At that
isolate?
point, we would figure out, depending on whatever the quarantine guidelines say, we would figure out who was actually exposed, and they would need to go home.
Okay.
Yep.
Okay.
Yep.
So we have gotten questions from our association, questions from some parents. So I'm just going to kind of tick through some of these questions,
Sure.
if that's okay with you. And bear with me here because some of these aren't applicable to her, so I'm going to try and pick through them as we go through. So in some of the younger classrooms, right, I know that there are high touch point surfaces when we think about doorknobs and push bars and light switches and all those things. But in some of the younger classrooms, they are touching and sharing toys and materials.
And that would be not recommended.
So is there a recommended sanitization?
So the EPA has a list of recommended sanitizers. It's called the red list, I believe. If you Google coronavirus recommended sanitizers, you'll get the whole list. Lysol is one of the items that are on that list, but it lists it out. It lists what the name of it is, the concentration, everything, and then I believe, if I recall correctly, it also says what it's safe for, whether it's like plastics or fabrics or things like that. And so I would send you to that list to look at the disinfectants that you already have, because many of them are probably on that list.
Sure.
And then if you needed to purchase other ones.
But I think in terms of like sensory bins or shared books or those types of things, it sounds like you're not recommending not to utilize.
It's not recommended if you can avoid it.
Okay. And if we can't.
And if
then
you
it sounds like
can't,
sanitization between.
there's sanitizing between uses. If it's things like books that really can't be sanitized, right now I believe the recommendation is that they sit aside for 72 hours and then they can, so like a library book, someone would check out a library book, they would have it for a couple of weeks, they'd bring it back, it would sit aside for 72 hours, and then it's considered absolutely safe to be checked out again. I've seen a lot of things that say 24 hours is plenty, but I've read in guidance that 72 hours is what's recommended.
What about outdoor play? I'm thinking like recess.
I'm all for recess. I think the kids need that physical outlet. So coronavirus is somewhat affected by UV rays. They use UV sanitizers in ambulances. And so I guess my opinion on it is if they can socially distance or at least cohort. I know we've had conversations about cohorting. And what that would be is if you have a group of 20 students and you can try to keep 5 of them together, so like 4 groups of 5 or even 2 groups of 10, then you obviously are going to decrease the amount of exposure to that group. And so if you can cohort with recess, that's another place where you can decrease exposure.
I really like how the American Association of Pediatrics talked about that.
Yeah.
That, you know, when you think about benefit, harm, not allowing that social interaction compared to using a strategy like cohorting and small grouping and,
right.
You know, smaller groups outside at recess, you're going to get more benefit from that than isolating.
Than not allowing.
Yeah.
This is another, I think, kind of what if question. But let's say we're in this group. I test positive on Monday, and then Sam tests positive on Thursday. Does their quarantine period
Start over,
or does it stay with me?
Okay, so if you test it, so today's Monday.
Yep.
Let's say you test, it's going to be easier if you test positive tomorrow, then, and we were within 6 feet, their quarantine would start technically tomorrow, although we probably wouldn't know about it for a couple of days.
Sure.
If he tested positive on Thursday, but we had no additional contact, quarantine would stay the same.
Okay.
If they hung out on Wednesday after he's in quarantine, so is he, and shouldn't have, but he tested positive, his quarantine will start from the date of last exposure to him.
Okay. So date of last exposure.
Yes, quarantine starts from the date of last exposure.
Okay.
So if you're and that's why we ask people in the same household, if at all possible, to isolate within their household, because if they don't, the person who's on that 10-day isolation and the rest of their household now has a 24-day quarantine.
Sure.
Because the isolation period had to end before the quarantine period could begin.
What about what is the recommendation on things like band and choir, where there is projection of voices and
I wish I could
particles?
answer that for you. I don't have a lot of guidance on that yet.
Okay, fair enough. bear with me here, I'm
Yeah.
looking through. A lot of these questions are more our policy questions.
You address testing for me, so if we have a student that shows symptoms, and we send them home, is there a requirement that they get tested?
Nope, they are not required to be tested. But if they have symptoms, and those symptoms are consistent with COVID, and you write a policy about a symptomatic student that says a symptomatic student will isolate for 10 days, then you can make them stay home for 10 days. But there is no requirement for them to go and get a test. Now, if I were you and that were the policy you put in place, you could highly recommend that they go get tested, because if they come back negative, they can come back to school as soon as their symptoms resolve, just like any other illness.
Does Dallas County provide any testing sites or equipment?
We don't. The state has a Test Iowa site in Waukee. Last I heard, though, it was about 4 days out to get a test there. What we recommend to people is if you're symptomatic, that you call your primary care physician. And honestly, if you're symptomatic, even if you're not planning on getting tested, we recommend you call your primary care physician.
Do doctors' offices have tests, or do they refer elsewhere?
Most of them, well, it depends on the office. Some of them have them in-house, some of them refer elsewhere. The larger health systems have more centralized testing locations, and so there might be a possibility that somebody would have to drive somewhere to get that test rather than just go to their doctor's office.
I have a question about restrooms with air dryers. Is that safe?
So that was a new one that I heard last week, and I haven't gotten a lot more guidance on it. The reason that they are looking into that is that a lot of air dryers are placed at an adult level, which is a child's face level. And so they're thinking that as the air dryer blows in the child's face, it could possibly aerosolize some of those droplets. The last guidance that I read is that they're recommending that you turn off your air dryers and go back to paper towels. That was a single piece of guidance that I saw last week. I have not seen anything else about that.
So I think that ticks through the specific health questions that I had on your list and your list. Do the two of you have any specific questions for Dallas County? We'll talk about like our policies in a little bit, but any specific questions for her?
Yeah, if I could. When you were talking about the masks and as far as the mask being a tool, but if the students wear the mask, I teach the high school students,
Okay.
the age range where it's,
Easier.
the numbers are very, well, yeah. But if they're wearing a mask, I'm wearing a mask and a shield, then the chances of transmission even goes down farther if both are wearing it at that age level.
That's
18
correct.
years old.
However, depending on the situation, mostly what kind of mask you had on, if you had on a shield as well. And so right now, the only people that are considered protected by wearing PPE are healthcare providers, and that's because they've been trained to wear it. In a situation where you're in a classroom and you're both wearing masks and one of you tested positive and you can't say that you socially distanced, the other one would be placed in quarantine. Yeah.
Thank you.
I'm gonna open it up. Anybody else have any questions for our expert while we've got her?
I just have one with regards to water fountains. What's the recommendation for push button drinks water fountain versus water fountain?
The recommendation right now is that each child bring a water bottle from home and fill it in a water bottle filling station, and that water fountains are not used.
So just for those that are at home, the question was around water fountains and if they should be used or what the best practice is there.
You said about recess. What about the playground equipment?
Can you say that one more time?
The playground.
The playground equipment.
All right, her question's around recommendation for playground equipment.
I believe there's guidance out there. I'm not extremely familiar with it. I believe that it says that if at all possible that the playground equipment be disinfected in high-touch areas, that you try to do so. But obviously, some playground equipment doesn't lend itself to that.
I do have another question, if I could. I'm sorry. With the middle school, high school, our students change classes. So what's the recommendation as far as cleaning our desks, our tables, our doorknobs with the next group of students coming in?
So the recommendation is actually not to have them change rooms, if possible, and to cohort within the room as well. If that's not possible, then one of those approved disinfectants for surfaces that can handle a disinfection would be what would be utilized.
After each change of class?
Yep.
So today on a meeting, they talked about the Iowa Department of Public Health coming out with something in early August.
Yeah.
Just for my sake and for this group's sake, kind of differentiate between the role the Iowa Department of Public Health will play. You talked about, from the Dallas County perspective, you'll be one-on-one with us with those cases. What role do you think the Iowa Department will play?
So the guidance that we follow comes from them.
Okay.
And if absolutely necessary, we have a regional epidemiologist that works for them that we have called in certain situations. Actually just called him today because I had an odd situation come up and I needed to walk through it with him as well. So we certainly can call someone in from the Iowa Department of Public Health if we need more guidance. But like the written guidance comes from them, and then it's up to us to try and make sure that we communicate that guidance and work with the local folks in our county.
So in the governor's new proclamation on Friday, it kind of talked about the 5 instances that there could be a school closure. And so in a lot of the incidents, they talk about the governor's office, the Department of Ed, and the Iowa Department of Public Health. But I think the Dallas County Public Health we'd probably call you first.
Yes.
And you may say, hey.
Yep, and then we might say, hey, let's call somebody at the stage.
Okay.
Yep.
Excellent.
Yep.
I do have a quick question. Some of our preview students share lockers because we have a morning and afternoon section. I'm guessing that's probably not recommended.
Lockers in general right now are not recommended.
Okay.
I know that schools a lot of them are vying with how to deal with that. Some schools are looking at, in particular, high school students carrying a backpack if they have to switch classes. But yeah, lockers are considered a high-touch surface that isn't easily disinfected, particularly the inside of the locker, and so it's not recommended to use lockers. If they have to be used, then some kind of a safe disinfection spray would probably be your best bet.
Alex has a question, I believe.
With some of our littler kids, like the 3 and 4-year-old preschools, is there anything to be said for kind of these plexiglass dividers on tables and stuff between the kids?
Maybe, which isn't helpful. I think that plexiglass dividers certainly have a place, and in like administrative offices, possibly in smaller classrooms, where wearing a mask for the teacher isn't always an option because, you know, sometimes you need to see faces and things, that having some kind of a barrier might work for that. I'm not sure that having them for the students. The thing about having a plexiglass divider is if you put a student in that area, they have to stay there. So are they going to actually stay there? And so that's something just to keep in mind when you're looking at those physical barrier type mitigations.
Administrators, anybody have any questions?
What happens when 9 o'clock hits, you get a call from mom, Charlie has tested positive, we just received a call. How do we know that, what happens with that classroom? I guess, as far as who cleans it, do they have to get out of that classroom until it is clean? But then that kid also walked out of that hallway the previous day, and I guess what does that look like? Because, I mean, the kid could have touched the drinking fountain, could have touched the doors, and how do we know that?
You don't know. And I'm hopeful that the guidance that's coming out this week or next is going to talk more about those types of specific situations. As of right now, what I can tell you is if he's a positive case and was in that classroom, then the kids that were within 6 feet of him for 15 minutes are considered exposed. They need to leave. They would be placed under quarantine. The surfaces, that the desks, the places they were sitting at would need to be disinfected. It's, like I said earlier, highly possible the entire classroom would be considered exposed and they would have to quarantine, in which case then the room would have to be cleaned. But you're not going to have the kids in that room for 14 days then. The hallway, the guidance on general areas besides high-touch spots is that a routine cleaning is, and I believe it's a once a day, don't quote me, I think it's a once a day routine cleaning is sufficient for passing spaces that kids are not spending a long period of time in.
I do have another question.
Yeah.
Sorry.
No, that's okay.
Our preschoolers have nap mats.
Did you see me tense?
I saw you cringe. And I mean, I've read some of the information about how when they are napping, ways to socially distance them and spread them out.
Yes.
Spread them out. I mean, I've read that. But what about like the storage? I mean, obviously, it's probably not recommended.
Do they each have their own?
Mm-hmm.
They don't share.
No.
So.
And they keep them in their lockers.
I guess in that case, I would say that if you are cleaning them on a regular schedule, like you're cleaning the rest of the classroom, and they can take that disinfection, they should probably be okay.
Okay.
As long as they're not sharing them.
Yeah, no, they don't.
Okay.
Thank you.
Yeah.
Tiffany?
What if you have a few students or more than one that are symptomatic that are waiting for their parents to come get them? Do they each need to be in a separate room?
So the way that I know some other school districts are dealing with that is they will have a set-aside isolation area, provided that all the students are symptomatic and you can keep them 6 feet apart in the isolation area. You can have more than one in a room. They should. One of the things that I know some other schools are looking into is adding a provision to their medical, I don't know if it's a waiver, Christy, you might know. Like if to give permission for ibuprofen or Tylenol, one of the permissions that some schools are adding is to place a surgical mask on a symptomatic student before putting them in that designated isolation area. And that's to contain any coughs, sneezes, breath that they would have.
Becca has a question in the back there.
What is the requirement for a parent, guardian, or staff member to notify the school or the employer of a positive test? Or is IDPH or Dallas County Public Health forwarding that information to the school nurse?
So the requirement for a parent is right now none. Staff member would be up to you and whatever policy is in place for illness of staff members, up to, the schools. The requirement for the positive test goes to the state notifies us, we would talk to the parent. If we find out that they're in a school, we would be calling the school because we would have to do the contact tracing.
Does that answer your question? Any other questions about for the medical professional?
Maybe a little clarity on that. So if they go home with some symptoms. We're not borrowing tomorrow's trouble today. We're waiting for a positive test.
Right. Yeah, that's the only other thing is if they're symptomatic and they don't get tested, I'm not going to be calling the school. So, but if they're in the school symptomatic and you send them home, then obviously you would have an idea of,
Right.
yeah.
Well, I want to say thank you for your time tonight.
You're welcome.
Thank you in advance for our future partnership. I have a feeling we're going to get to know
Yes.
each other
That's
really well.
Quite all right. That's what we're there for.
Yeah, Suzanne answers the phone. When I've called multiple times and she answers.
Yeah, when
the
my
phone.
receptionist is gone, it rings back to me. But don't
Yeah.
tell everybody, okay?
But I want to say we appreciate that because as everyone has been so busy with this, sometimes it's hard to get guidance and it's hard to find support. So we're very thankful that you are available and
Yeah.
willing to listen to us. So
Very good.
we look forward to working with you as we continue to figure this thing out.
Okay.
Thank you very much.
You're welcome. Have a good night.
Thank you. You too.
Thanks, Suzanne.
I think that's a natural transition to our return to learn plan.
It is. So I'm going to stay. This is going to be hard for me. I'm going to stay seated and not talk with my hands. But first, I'd really like to say this is a complex problem. I think sometimes I certainly hope that tonight we don't oversimplify this complex problem. It's one of the biggest challenges I've ever faced in my career, and others. So obviously we're going to have to work together on this. And I think we've put together some things, and I'll answer the WGA question right now. Who should be doing? The teachers, the on the ground, the boots on the ground people should be part of this. You know, when you think about a decision-making model, and I've shared this with my administrators before, there's some refinement, there's some evaluation and refinement, and we've really failed if we don't do evaluation and refinement of even the mitigation strategies and what we're doing in the buildings on a regular basis using our teachers. So let's talk a little bit about what we're thinking about. Boy, I found a lot of joy yesterday being able to honor those seniors. So the class of 2020 graduated yesterday. I'm glad we had an opportunity to celebrate what they've accomplished. And what I don't want to get lost here is why we exist. It's a school district, building futures, one student at a time, in a supportive culture of high expectations. And I think sometimes in a health crisis like this, it's hard to take your eye off that prize. But educating students in the most optimal experience is what we're after. And I was kind of thinking about this little scientist when I found this picture. I'd love for, I hope I don't see it, I hope this is a once in a lifetime, but I hope somebody from Woodward-Granger, some scientist from Woodward-Granger solves a big pandemic problem 50, 60 years down the road. I want to prepare them for something like that. So among the conversations that we're having, we also need to remember that parents are counting on us to provide an exceptional educational opportunity for their kids. So that's important. I need all of you. This isn't something unilaterally that I would expect the board to decide or the superintendent or the administration. We need to work on this thing together. I read an article this morning, and quite frankly, I should look into the camera and say I need you parents as well. What we do, how we behave over the next 4 to 5 weeks, quite frankly, could drive what our fall looks like. You know, if we kind of take this thing serious, we kind of change our behaviors and think about the ways that we can behave to maybe slow this down a little bit. I'll just be frank. I drive around. They call me Frank Adams. I drive around the neighborhoods and I see a lot of kids interacting. I see a lot of kids together. I know I've heard stories of at Big Creek how everybody's gathering. I think we just I really just ask that we all kind of do our part in the next 4 to 5 weeks, because I really want kids back in school. Kids need to be back in school. And so I think all of us could kind of help with that. This is for my nurses in the back row. I think the responsibility that we have, and I like what Suzanne talked a little bit about, is I think some screening can happen at home. We've said for 100 years, my whole career, diarrhea, vomit, fever, stay home. I think maybe in my experiences, it's a badge of honor to come to work. You might not feel quite well enough, but you kind of tough it out and you come to work. I think I'm changing my opinion on that, and I hope others do as well. If you're sick, stay home. I think that's our messaging, is along with kids. If they're sick, stay home. I know that that's challenging, but just the implications. Maybe, and I'll just take, maybe, you know, we maybe gave our child some ibuprofen, broke the fever or something, and, you know, maybe got a phone call later. I'm just saying. So it's really important that if you're sick, stay home. Nobody teaches routines better than a teacher. Nobody. And so when I really think about the things that I'm going to talk about here in a few minutes, Kendra and I, we had a great conversation. It's like, hey, let's talk about it now so we can start teaching these routines at home. And I think that that's really important because we can all kind of play a role in that. Here's the things you can expect. Here's what a day of school will look like for your child. Here's how you can prepare them for that. And so the connection, the relationship between teacher and student is a tremendous bond, and being able to start right out of the gate on here's what you can expect school to look like. I love the videos the nurses put together for me. I think it was Alex that said, hey, the doctor's office, remember that? The doctor's office might look a little bit different. I think we need to start preparing our students for what school might look like for them. And sooner than later. I like your date. I think beginning of August is a perfect timeline for something like that. We need to get our eyes back on these kids. We really do. There's a lot of evidence out there. I think I've shared that maybe with Kendra and Christy, and we were talking a little bit about it, in terms of just, what the state has recognized for the amount, the referrals for child abuse. It just absolutely plummeted, and you know why? It's because teachers didn't have eyes on kids. And when I have students come in and sign a school permit for them, I always say, who's that one pro-social adult in your life, that you can go to? And they always have a couple, 3 names that they rattle off. And I just think that that's so powerful, the connection that teachers make with students. And we're missing that, and they're a little bit isolated from that. And to be frank, we have some social, emotional, mental health work to do based off of that. And the best place to do that is in our buildings. There's also a human resource aspect to this. I tell you what, we've got caring teachers. We need to take care of them. They've got needs as well. They've got concerns as well. We need to hear those, listen to those. We also have some what I would call possible human resource needs based on what we're doing. You're hearing more sanitizing, more cleaning. Talking to Alex a little bit about how do we office, and we'll have isolation rooms running and regular nurses' office running with the kind of the first aid and kind of the normal stuff. And so I think we need to talk a little bit more about that. And I think as we dig down into more the building level, we'll identify those pieces. We'll talk a little bit about some tonight in a later agenda item. So let's get started. First, the school bus. I'm gonna make an ask. Parents, if they can take their child, if they have another means besides the school bus, I'd love for them to use those other means. I actually had a conversation. She said I could share this. Angela Sebastian and I were talking, and her neighborhood has already organized themselves. They've already decided that let's minimize the number of students on a bus. Let's organize ourselves and do some carpooling, and she's more than happy to talk to other neighborhoods that might want to do that. Talk to Max Christensen at the Department of Ed. He feels like 2 to a seat with masks is appropriate. We do have some bus routes that take more than 2 to a seat. Obviously, we could cohort group with families. We'd load from the back to the front. They'd be assigned seats, and make sure that we manage it that way. So we would really, like I said, our ask is if parents could drive their students, if they can drive their students, recognizing that not everybody can, and we'll still provide transportation. Once the route is complete, whether that's morning route, 8 p.m. route, or even an activity route, we're going to sanitize the buses. Dave bought a 2-gallon sprayer for each of the bus drivers. We do have that list of chemicals. You've approved several bills that included a lot of PPE and a lot of chemicals for Megan, if you're wondering what that organization is. Plenty of chemicals to disinfect rooms and buses and hallways and touch surfaces and all of that. So once the kids are off the bus, we'll spray those down. It's a 10-minute dry kind of kill period. Obviously, kids aren't on the bus. They'll be dry and ready to roll in the evening. So that's our plan for the buses. I talked to principals. We got to minimize the number of entrances and how we manage people coming in and out of the building. I think all the principals have 2. They have 2 entrances. Obviously, Matt is going to use, I think, let me get my directions right, Matt, that faces east. That's the east-facing door, and then you're going to use the north-facing door. The high school and the middle school both use their front entrances, and then the gym on the backside where students park. So really limiting the number of access points, and quite frankly, that's for teachers as well. We just want to make sure that we're limiting that, so when we disinfect, we're not missing something, similar to what Suzanne was talking about. And so principals will go through all of that. This is an interactive presentation, by the way. I told the principals that I would pause if they want to share anything, and teachers as well. I mean, this is open dialogue, or mom, if you want to share anything. So that's what the entrance is when we bring the students into two different entrances. Congregation of large groups isn't going to happen. So wonderful. I was there. What a great assembly for Student of the Month. Talked to Matt a little bit about that. Any of those activities where we gather large groups of people, we just can't do right now. In the morning, elementary students will actually go right directly to their classroom as opposed to being kind of held up in the gym. Middle school, both Jake and Rob shared a plan to kind of direct students based on whether they're eating breakfast or not. I don't know if the two of you want to kind of share your idea of how students are going to be managed in the morning.
Kids who eat breakfast and we don't have a ton of them, they'll go to the cafeteria and eat breakfast there. If they're not going to eat breakfast and show up earlier, they'll go to the middle school gym and we'll just have all sets of bleachers out and space everything. So we'll have some sort of seating arrangement where, hey, 6th graders are in these sections, 7th graders and 8th graders. And the nice thing is we do have a large amount of our middle schoolers who still bus and don't get to school until 8 p.m.
Come on up. Should put that back out there.
Sometimes I forget that online.
Here. Only we can be 6 feet apart.
Maybe in stereo.
All right, I'll start over. So, our students who need our school lunch or breakfast in the morning, we're going to have that available to them. They're going to go to the cafeteria and have breakfast there. We don't have a ton of middle schoolers who do that because we don't also have a lot of students who show up before 8 o'clock. So if students get to school beforehand, we're going to have them go to the middle school gym, and we'll pull out both sets of bleachers and have designated areas for students there to spread them out as much as possible. One of the big reasons why I wanted to do that was to still allow for my teachers to have as much time to just prepare for the day, because I did not want them in their classrooms with students as possibly early as 7:45. And so I do believe that Ms. Starsovich and myself can supervise students in those areas effectively. So that's what we'll be doing there.
Are we looking at a similar approach for the high school?
Thanks,
Yes.
Dick.
Okay.
We're just going to use, instead of the middle school gym, we'll use the high school gym.
Perfect.
Very few high school students eat breakfast in the morning. What
Okay.
they do is right before the bell, they're running through and grab a juice.
Sure.
Or a milk or something. They don't sit down and eat breakfast. The high school kids don't.
I don't think I've ever seen more than a handful of high schoolers in there.
And there might be one lifting starts. They got that with lifting and they're hungry. They don't have time where they don't have that first period open. When they don't have class, they're grabbing something quickly to supplement before them.
Okay.
So this is really a student management. We're not going to have large groups of students congregating in our buildings during school hours. Okay?
The after school,
No, in the morning.
those are elementary students, and typically, that's why we're not going to be in the lunchroom, is because the elementary students will be there. And typically, the high school students don't arrive. The elementary students, the buses leave around 8, and the high school students don't get there that early. There are some students who come earlier, but they're also going to see a teacher. That's where our student population is different than any other population, because our kids come in and see a teacher, or they wait until 8:19 to get to school and run the first period. We also, and when you talk about that congregation of students, the high school students come there are some students that talked to Mr. Gruen this morning. There are some high school students that come to the elementary to get on the bus, that ride the bus up. Typically, Mr. Gruen said they wait outside. He said there's just a handful of high school students, more middle school students, so we will social distance while the weather's nice, and then find an appropriate place for them to wait for busing. Likewise, with the elementary students at the high school, they'll be able to be distanced because we're going to make sure the middle school, high school students aren't in there occupying seats. Sometimes people just go in there to hang out and visit, and we need them to go. That's why we're opening up the gyms, to make sure that we can have designated areas for the students to congregate in small groups instead of one small area where there's a lot of people.
So I think, the bell starts, the school starts. This represents traffic flow. Real important. I've kind of challenged all of the principals and you in the building know the building best and how traffic works and flows. We're all familiar with grocery stores that have directional traffic, and I think there's opportunity there in the buildings to think about the flow of the traffic and how that's going to work. And it kind of goes with my bell here. I'll be frank, I kind of pushed back on Jake, I think, one day and said there's got to be an opportunity here with staggered bell times. I know it's challenging, but it's a mitigation strategy that every time I pick up an article, it talks about how to minimize the number of students in a hallway and during passing time, and so kind of push back. So what'd you come up with? Am I putting you on the spot here?
Okay. Almost a guess and check type option of what we think's best. Is it where I say, hey, this teacher, on these certain periods you're going to let out at this point in time? So then can we look at our school schedule and figure out where are my groups of kids going to stagger that best? Or is that a little bit too complicated to figure out throughout the entire day, as we really don't have any teachers that only teach about one thing. We've got a handful, but a lot of our teachers are teaching multiple. We even have teachers where they're teaching high school kids and middle school kids, and then to think about that crossing pattern as well. So the two ideas we came up with was the one where we're going to designate teachers and, hey, here are your passing times, and we'll just have that posted for them throughout the day. Or would you get the same effect if I said, you teachers, you're always going in the first passing time, and you teachers, you're always going in the second passing time? Now, what's going to happen when we have kids show up to a class and the others aren't out yet? They're just going to have to line up on the opposite side of the wall. And probably my biggest thing to my teachers says, we're going to be in the hallways every single time kids step out of your classroom. And so we're just going to have to do a team aspect there and be in the hallways every single passing period and help them out. So, but as far as which one of those two will be best, I don't know that answer. So we're gonna watch and try, and we're gonna leave that probably up to my teachers to see what do they think will work best. So.
Have we had any discussions or considerations of leaving the kids in classes and moving teachers? Well, we would. One of the things that I talked with Dr. Adams about today was, I'm sorry, I didn't understand that. We could do that. However, when we're looking at an education with high expectations, we start talking about the high school's different. You and I can be in the same English class, but you took geometry as a freshman because you were in algebra as an 8th grader, and I'm in pre-algebra as a freshman. So some of our classes are going to be split. So it doesn't always work out that way because it's not just math 9, English 9, science 9. We're allowing the kids to choose what their interest levels are. So that would be a little bit more challenging for us. So not that we're still not thinking about how to do that. It's very difficult when you have the courses that we offer. That makes sense. What about the middle school level?
We even have different math classes for our middle schoolers. So not all 6th graders take 6th grade math. And so each grade, 6th, 7th, and 8th, has 2 options per grade. And even for a few students, for example, my first year we had some kids who were 2 grade levels beyond grade level.
So then we think about students entering the classroom. We talk a little bit about classroom arrangement. I talked to the principals and I said there might be some fixtures, furniture, equipment you might want to remove from the class. When I look at the American Academy of Pediatrics, they do talk about, and you noticed in the WGA presentation, 3 foot to 6 foot. I think they talk about there's evidence, and correct me, Suzanne, if I'm wrong, there's evidence that 3 foot might provide as much benefit as the 6 foot. And so thinking about if we could have as students and all facing the same direction, you don't ever want students facing one another, but 3 feet to both sides in front and back, and setting up a room in a way that we can do that. Here's where I think, and we're going to have more of a mass conversation on a slide later, but here's where you really think about that is a tool. Most of our classes, Dave, I'm just going to say it, 800 feet square foot. Kindergarten classrooms are a little bit bigger, maybe 950. I always had 1,000 in my head, but ours aren't quite 1,000. This might be a perfect situation to talk about the mass being a tool to mitigate the fact that we might not be able to even go 3 feet in some situations. What I really like about this article, when it really asks you, and I'm sorry to the Academy of Pediatrics, it's really talking about that harm benefit. And what I really like in terms of talking about distancing and wearing masks, I'll be real frank, I'd rather put a mask on a student and allow more students in than have students working remotely. And that's basically the harm that they talk about in this article. That if it costs you students not being in the classroom, it's probably not the best mitigation strategy to be using. And so I think that's where masks can really play a role in allowing us to accomplish what we want to accomplish. That's having our students in front of us. We're best when our kids are in front of us. There's actually evidence, Suzanne, in this article that talks about the detrimental effect of having students out of school this last spring. Is that correct?
Yes.
Yeah. So when I think about cafeteria, we can't all shove ourselves in the cafeteria. We already said we're not going to congregate in large groups. So lunch is kind of the same way. Matt, all of you have kind of shared kind of your strategies about maybe adding more lunches, using additional spaces than the lunchroom, maybe classrooms. So Matt, you want to just talk about, we've had Jake talk a lot, you want to talk about what you're thinking?
Sure. Let me take, just for instance, second grade. We have 4 sections of second grade, and we have one of the biggest cafeterias in the district. And I was just in today actually with Bruce, and we were talking about how we could space the kids throughout the cafeteria. Logistically, maybe we can get a full classroom in there. If it all depends on August 24th, if it's 3 feet, if they need to be facing the same. It just depends on what recommendations are out at that point in time, because we can make a plan right now, or August 3rd, or August 10th, August 17th, and then August 24th happens, and then things might be changing. But we've already got options where maybe every other day, one classroom eats in the cafeteria, the others eat in their classroom. Again, I think it comes down to that cohorting, trying to keep the kids. And if they are in the lunchroom, we'll have marked off spots that the kids will sit. They won't get it again like before. They get to sit next to their buddies. There'll be, until we hear differently, there'll probably be mandated spots where the kids are assigned to sit, a direction that they'll be assigned to face. It will not be the lunchroom of old that we will have. Also extending lunch times so that not all second grade comes in at once. I've got Dave, he's going to work on an electrical issue that we have in this cafeteria that will fix our flow going in and coming out, so we won't have cross traffic when the kids are getting rid of their trays, type of a thing. The ELC, again, it's extending the lunch. We may have kids that are eating lunch at 11:15 and not getting done until 1:15. It's just going to be, and more than likely the teachers are going to help supervise that, whether it's back in their classroom or if their classroom happens to be eating in the cafeteria. So I think when Dr. Adams put up that slide that we need you, it's going to take all of the teachers and associates that we have on staff to make sure that that's accomplished. It can't just be myself and a couple extra adults enjoying the luxuries of the elementary or ELC cafeteria. So, and preschool, we're going to try our best to try to get them into the cafeteria, because again, that's a learning environment Plus, I cannot imagine them coming down to the lunchroom and then going all the way back up to the preschool area.
Carrying food.
No.
You got it.
So we have a BLT meeting planned every Monday at 1 o'clock starting on August 3rd. That way things are going to be fluid and they're going to change.
And
It's
BLT is building
leadership team, where there's a grade level representative from each grade. Our specials are represented, our special education is represented. So everybody from every grade level is represented at the table when we do. Nurse Alex will be there for all of those as well, leading up to the start of school.
So I've had a couple, 3 conversations with Tahir specific to this, you know, from, you know, not having self-serve to where they'll serve so they're not touching spoons and whatnot, to kind of a boxed lunch approach, to minimizing menu items. We will fail if kindergartners are taking soup to their classroom. That'll be a fail right there. That's why I'm evaluating you, Matt, right there.
We will fail if any of the ELC is taking it.
So, you know, clearly, what I think what I put in correspondence with you is the principals and others can work on menu items and talking menu with Tahir to ensure that it's something that works. You know, the other, and we haven't talked about the power of outdoors. That was something Kendra and I talked a lot about. I mean, that's, you know, on field trips, kids love to sit outdoors. That we got a lot of green space, and on beautiful days, there's no reason we shouldn't be accessing that green space, whether that be for the classroom, for lunch, fill in the blank, and spread out. So I think I was telling Kendra, boy, if I were a teacher, I'd be finding myself a cart, putting my math and my reading on that cart, and heading outdoors and spending half a day doing my reading instruction and math instruction outside. So a lot of opportunity there. Thank you, Matt.
You bet.
Anything the two of you want to add?
We're going to use both the commons down by the high school gym and then our upper. So we'll have about 100 kids per lunch shift. Split that up into 2 groups of 50. That will probably be the most spread out. That will be the whole day. So to me, that was a fairly easy fix.
Yeah.
And we talked about offering open. Right now our seniors have the opportunity to leave campus for lunch. We talked about maybe opening that up to juniors, to eliminating more students in the lunchroom. Maybe possibly adding more lunch schedules or having lunch periods go throughout different parts of the day as well.
So Dave's not here, and I didn't talk about my prop as I was talking about classroom arrangement. So we were kind of having a conversation last week and talking about how important it is, particularly maybe in lower elementary, for students to be able to see your face and whatnot. So this was actually an idea. I think it was just Ken and I and Ashley. We were just kind of talking and, hey, what if? And so something that, this is my prototype. This was scrap lumber, by the way. We can certainly make them look nicer, but really something you can put on a kidney-shaped table and be able to have as the teacher, so you can pull down your mask and instruct to the students who might need to see, whether that be foreign language, early literacy, ELL, you know, type. So that's a possibility, and we're poised and ready to build those for you, the teachers, if need be. So I want to pause here. What questions, things you've heard, what questions might you have? I want to make sure your voice is getting in the room.
Can I ask you a quick question?
Yeah.
Is there any plan for like parents who aren't comfortable sending their kids back?
Yep, you're on page 8. I'm still on page 7.
I'm always 1 step ahead.
You're way ahead of me every time. Yeah, every time. So playground did come up. I think as I kind of read through this really quickly, it does talk about routine cleaning, especially pieces that you touch, railings and things like that. But really, the greatest point of leverage on the playground is cohort grouping and limiting the number of students out on the playground at any one given time. And I think that's the kind of the advice that I shared with Matt, and I know he and his BLT will put together a schedule that makes that work. So it wasn't until Suzanne taught me this, quite frankly, I didn't realize the power of cohort grouping and how much power is in that. And I really started thinking a lot about the conversations that I would have with Dallas County or with the Iowa Department of Public Health. So when Suzanne calls me and says, hey Matt, how many exposures, who had close contact within 6 feet for 15 minutes. I want that list to be really short. And to get that list really short, I think cohort grouping is powerful, where if you're sitting, you're sitting by the same person on the bus, you're sitting with the same person at lunch, you're sitting with the same person in class, and so you're minimizing the number of interactions and close contacts that you're having with one another. So that would be my challenge for the principals and building leader teams. I love that challenge. I think Dave threw out a challenge. Is there opportunities? And one of the things that as I read it says, focus on the things you can do, not on the things you can't do. There might be some opportunities where classrooms, Jake, can be in the same room and the teachers move. Maybe not all the time, but maybe there are some of those opportunities. And that's what we're really trying to do, is capture as many opportunities as we can to minimize the number of exposures for the adults and for the students as well. So really, as you're leading your buildings in the nuances of what's going on in your building, there's a lot of power in cohort groups. So find those. As I said, Christy reminded me that I said reimagine. We got to throw away a few of our paradigms here. We got a lot of paradigms in our head of what the classroom needs to look like and school needs to look like, and I think there's an opportunity to kind of suspend some of those paradigms and think differently, because boy, these are different times, quite frankly. So I want to talk about in the classroom and in the hallways, touch surfaces, and thank you, Mindy. I think it was you that asked that question. I think when I say I need your help, I think students can help. I think teachers can help, custodians can help, everybody needs to pitch in. And so those high-touch surfaces need to be hit regularly. I read an article that said, leaving doors open. So rather than people grabbing the doorknob and opening it all the time, let's leave some doors open. That's counter to maybe what the fire marshal would say, but I think in this situation, that makes more sense to me. So leaving some doors open so they're not touched surfaces. Thank you, I didn't think about drinking fountains. We do have water filling stations, and I would commit to more water filling stations versus drinking fountains if that helps us get through the time that we're in. And Dave knows how to install those. We just did in the middle school, I believe. Is that right? So as far as the classroom's concerned, we'll hit those high surface touch surfaces. If teachers can do that and students can do that, not on a punitive, it's not punitive, it's just everybody, it's that culture of responsibility that we want to develop, and I think everybody be willing to pitch in. And then the same thing in throughout the hallways and those areas. I do appreciate that recommendation, that general routine cleaning, in those passing areas. I think I heard a challenge tonight about lockers. I think I threw that challenge out to begin with, and I think we need to re-examine that piece in how we use our lockers, because I think currently you were thinking maybe allowing lockers.
I was thinking if we get, it sounds like they want to go to backpacks, and so I think it's something we talk about.
Yeah. Suzanne, does that make?
That's the recommendation
Okay.
now, is to avoid using lockers.
Okay.
We have a lot of students that just use their locker for their coat. I mean, we just have a coat rack. It makes me think of elementary. We just put a coat rack. That's what kids use. They all carry backpacks.
Okay. Yeah, I would go back with your BLTs and talk a little bit about what that might look like, not using lockers. Schools are welcoming. We want folks in here, but not during COVID-19. So my recommendation is to limit visitors, quite frankly, to the foyer. Let's say Jimmy forgets his PE shoes. Call into the office, say, hey, I'm bringing in Jimmy's PE shoes. We'll have a table out in the foyer. We'll get them into the foyer and place them at the table in the foyer, and out you go. Same thing with vendors. This is something, Dave, I did change. I hope you noticed my update in my Q&A. In talking with Dave Smeltzer and how this has all worked, we get a lot of supplies on pallets. They call ahead to the custodians. They meet them at a back loading dock, back area. And then I think FedEx and UPS, kind of the same thing. They come into the building, they get into that foyer area, leave the item on the table in the foyer, and out they go. So I'll be real frank, I don't even want visitors in the front office. If we can just eliminate the number of people in there. Again, what was the name of my game? The least number of people interacting and exposed to each other. So let's just do school business in school. Okay, does that make sense? By all means, we're still welcoming to our schools, and we want Jimmy to get those PE shoes or that cold lunch. But I just think for the sake of the well-being of everybody in the school, we need to limit that. I really appreciate what Matt talked about. This slide speaks to facility use by the school district. The governor said starting July 1, all school activities resume. That's why we did our board meeting, on site, because we're kind of back. I would say that the summer ball season was a huge success. And it was because of Matt's leadership, and it was because of the coaches. I happened to be down there at a couple practices just by chance and watched and observed them do all of the regulations and follow all the regulations. And Tim, I didn't see a single sunflower seed all summer long. And on a baseball season, that's hard. Lori, right? Did you see any seeds?
I did not.
Yeah. So that's a big change. And so I said at the beginning that if we do these things well, more opportunities are going to come and present itself. And quite frankly, I'm betting that they're evaluating how baseball went and are more comfortable right now offering fall sports. So if we all pitch in and we all do these mitigation strategies and whatnot, we have a better chance of continuing to open up these opportunities for our students. The other facility use is with community use. Ashley and I have talked a little bit about this. We have 4 classes of community use. Class 1, 2, and 3 being rec, I think I would still recommend that we offer that. I haven't taken a deep dive, but class 4 might be something we want to suspend, which is just kind of for-profit. They may not necessarily be Woodward-Granger community members. They just rent our space to maybe sell stuff. I don't think we have a lot of those. I'm not sure I'm going to get a lot of leverage or make a lot of hay there, but I think that, again, we're trying to limit the number of people that are coming into our buildings. I think I would recommend that we limit it to class 1, 2, and 3. Okay, and I can certainly bring that board policy next month. So let's talk a little bit about face coverings. I kind of like this because you're not just limited to the mask. Bandanas will work. These neck gaiters. I think Matt, you wear a neck gaiter, don't you? Yeah, and they're pretty comfortable to you. Or a scarf. Really, the name of the game here is to try to minimize the number of droplets, right, that are in the air. And I believe, Suzanne, I hope I'm not speaking out of turn. Are all 4 of these effective? Maybe some better than others.
Some are better than others, but all 4 of them are acceptable.
Okay. So this would be a great time to maybe, if, as folks are watching, I think it might be a good time to kind of try to land, in where we believe face coverings and what role they'll play within our schools. You heard me say on the buses, they need to be on the buses. You heard in the article that the pre-K probably not recommended. The benefit probably isn't there. Adults, I believe the adults need to be wearing face masks. And so, to be frank, knowing the size of the classrooms, knowing that I want them in the school, I'll trade people wearing masks for having them in the school. And to be real frank, I think that's the trade that we are. I think we are so good as teachers when our students are in front of us. I'm personally willing to recommend any mitigation strategy to ensure that our students are in front of us. And to be frank, I think masks is one of those. So that's kind of where I'm at. I'm just one guy, so I'd open it up for further conversation.
I think, in hearing what we've heard what the 2 of you vote on masks. Am I correct in assuming that you guys think the same, or requesting the same thing? Yeah. I think we've heard from our stakeholders that are in this room and also elsewhere that people are comfortable with masks and kind of wish for masks. I think the question is, right, what age is appropriate?
Right.
That's the magic question. I don't know that any of us have a specific kind of silver bullet on what that is. I think we've done a really good job of anchoring to guidance in a lot of the decisions that we have been making. Sounds like guidance says basically elementary on masks are recommended. Am I speaking out of turn here, Suzanne? Okay.
You might want to look at, and that's a date thing, it's not necessarily a policy thing, just having more mask breaks for those.
For the mask breaks for the younger kids. Yeah.
And we got 3 outstanding nurses sitting in the back row, and I want their voice in the room as well.
Absolutely.
Christy's done a lot of the heavy lifting for us, She sends a document and, well, it changed again. So it's always, well, it changed again, Matt. She's you know, she served on the planning team and has monitored that. So let's start with Christy and Alex and Tiffany. I want all your voices in the room on this one.
Thoughts on masks?
Yeah, I think that nobody wants to be in this situation, nobody wants to have to wear.
Can you come up to the mic, just for parents that are listening at home? Sorry.
So I think that nobody really wants this situation at all, but we have it. So in my opinion, by teachers wearing the masks, we're protecting our students and we're protecting each other as much as we can while we're together. However, if students don't have that, there's not that little extra protection for the staff. So I would agree that I feel it would be beneficial for students to have that.
So she's sitting down and Alex is coming up. I found the article very interesting. If you, the American Association of Pediatrics was more concerned about how the adults are interacting throughout the day than how they're interacting with the students. I found that fascinating. I see Suzanne shaking her head.
And I'll just speak to that because COVID really doesn't seem to affect children nearly the amount that it affects adults. There's a lot more concern about adult-to-adult spread once you come back to school than there is about children-to-adult spread.
Very interesting, even where it's talking about break rooms and how teachers congregate and how they hold meetings and all of that. So obviously we'd want to continue, you know, like as a PLC, maybe Zooming from your rooms on Google Zoom or staff meetings. But I found that very fascinating. I was more interested in the adult. So anyway, Alex, you have the littles. What do you think?
I'm on board with like the big picture of having the masks. And I think as a BLT level, then we just need to come up with the plans for our individual buildings. So what does it look like for washing the masks, or if someone forgets their mask or it breaks, or those kinds of things? And when is it appropriate to put masks on, you know, developmentally their age level?
So are you thinking kindergarten 12 then? Or what do you think? Is that what you're thinking? Kindergarten?
My 4-year-old actually keeps his on probably better than my kindergartner, but yeah, I think it's a good idea.
Okay. Tiffany, come on up.
I feel that masks would be a good thing to require for our students and for their safety and staff. Being in the middle school and the high school, I think I have a better advantage to the kids keeping them on a little bit better and following the rules. With passing periods and a lot of kids moving around, I think it's a very good idea.
Excellent, thank you. Thanks for sharing. You know, and I think, I kind of started this by saying there's nobody better to teaching routines than a teacher. We teach them all kinds of routines. So, to keep a mask on, it's an easy routine to teach. I told Kendra this, I think Matt, I personally anchored this in PBIS. Being respectful, because that's really what this is, quite frankly, that's what this is really about. By wearing a mask, I'm telling you that I respect you enough that I don't want my droplets to get on you and cause illness for you. So particularly when you can't be 6 foot apart. And I think about great teachers conferring with their students just naturally and leaning over their shoulder and talking about what they're writing or what they're reading. There's just I just don't think we can guarantee that we can keep 6 foot apart at all times, and this is a mitigation strategy for that. So, does that seem reasonable?
Yeah, so just a couple quick questions. So I'm thinking equity. Everyone may not be able to provide a mask. Do we have resources and capability to provide masks to those that don't?
We currently own thousands of masks.
Perfect. And then let's talk potential concerns around privacy. So maybe there's someone who can't wear a mask due to a health condition. When everybody else still has a mask on and that one doesn't, and the kids say, hey, why doesn't Sam have to wear a mask? How do we deal with that?
That's a great question. And that's actually, you're using my words against me here, because I shared that with you, and that is something that we probably wanted. I think I would refer to legal counsel, to be frank, on how that, I wouldn't be the only one. Are you hearing any kind of strategies or approach? to that comment?
I have heard about that is face shields would be more open for a child that maybe could wear a more tight-fitting mask. Face shields don't mitigate the same way, so they don't collect the droplets. So that child or someone may have to help them clean it more often. But that would certainly be something that they could possibly wear. The thing about that though is it's not a face covering, it's still going to look different.
Sure.
Christy, were you going to say something? I see your hand up.
Specific to Greenwood.
Sure.
On this one?
Okay, I do know that we've got some Greenwood people potentially listening or paying attention to this. So one of the things that Christy and I have discussed a little bit about masks at Greenwood is we agree that students and staff should wear them. We do have some students that may not feel comfortable wearing masks because it's not their normal routine. And our students are so routine based, and I know that all of our kids in buildings are very routine based. And so there are a lot of resources out there for us to work on desensitizing students to wearing a mask and work on gradually building them up to that. And that's one thing that we're able to then help parents and guardians and group homes with that as well. And when he and I met on Monday, and we discussed these on Monday, I also talked with the standpoint that like speech, we do a lot of speech and early literacy skills within all of our student population, even if it's our older students. And so having something like this, like he said, on the kidney table, but also in our speech language pathologist areas, is really important too, so that they can still see what our mouths are saying. We talked a little bit, just briefly via text today or over the phone, that maybe having a button with our faces on them will make students feel a little bit more comfortable. I mean, there's some different things that we can do so that students can still recognize us. Also, when it comes to behaviors and just the close contact that we've got with our students at Greenwood, we did order shields. So all staff will have a shield as well.
I'd like to get everybody's voice in the room here at the tables. We'll start with Troy, and we'll.
It's common sense. If they use common sense, go with the mask.
I'm certainly not advocating all day long. I think there's got to be some mask-free zones, and I think there's got to be mask breaks. I personally couldn't wear one for 7.5 hours, so I'm not sure why. I'd ask an 8 or 9-year-old to do the same.
I'd like to ask about Suzanne, what does a mask break look like in a school?
If you have a space where you know you're going to be able to have those kids socially distanced, if you're going outside for PE and you're doing yoga in the grass and you can have 6 feet between them, they probably don't need to wear a mask for that class. And so I think it just really depends on the teacher and how the teacher is teaching that day. Like if you're reading outside and you can socially distance, then the kids probably don't need to wear a mask. If you are in this room and you can socially distance, people are sitting on the floor or you have enough chairs spread around, then they could probably take their mask off for a little bit and get that break.
Common sense. Okay.
So just like all the guidelines always change, my opinion changed just through this meeting. Coming here tonight, I was thinking about, do the kids need to wear masks all the time? And I'm like, I don't know, just younger kids, I'm like, I just can't see them wear a mask all day. But listen to what the teachers would like to have the students wear, what you guys want to wear, the nurses, Suzanne, all for it. I think it's the right thing to do, that kindergarten through 12th grade should wear a mask.
I'm also really supportive. I think, having little kids, I can see the progression of the ability to wear a mask. I know I've mentioned preschool quite a bit. My 3-year-old's coming at you, Christy. I would really question his ability to wear a mask at all. So I maybe would think it'd be less safe to have them in masks, but I am more supportive as they're getting older to definitely wear a mask. And this is just Ashley's opinion. I'm not a doctor. So I'm just going to preface that. But I am definitely supportive of masks. I think my question is, and I think this is something that will come as we get more guidance, is what's the tipping point? So when do we decide that we don't need masks anymore? is that recommendation, I'm just trying to decide what level of recommendation we follow. Is that when the Pediatrics Association gives us that guidance? Is that from the state of Iowa? Is that from Dallas County? I think we just really need to be working in concert to ensure that we're really reviewing it on a regular basis and committed to that review process. Because at some point, knock on wood, this year, I'm hopeful that we don't need masks, but just how do we decide when we've reached that point, and how do we determine, as a team, because none of us want to make this decision in a vacuum, right? How do we decide as a team when it's that right point? And I don't know that we'll be able to come to that answer today, but I think that's something we really need to be thinking about is when can we turn the page, and what's that time frame look like? So.
I completely agree. I mean, there's going to, I would imagine that would hopefully, Suzanne, come from Dallas County or Iowa Department, or. And I think that's part of that evaluation and refinement as well. My hope would we do this really, really well across the state of Iowa, and because of that, we'll be able to start pulling back. I think they'll just as much as why suddenly some restaurants and large box stores have asked to put masks back on, because I think they're kind of monitoring that. I think if we do this well, if we all pitch in and follow the guidelines, and we have a better shot at them coming off sooner.
Yeah, for sure.
I got a question.
Yeah, what's that, Matt?
So if we're going to require this for schools, we're going to require this for activities, and people coming to watch activities? Okay, because I don't know what the guidance is going to come down from them, but if we're requiring this as a school district, and I don't necessarily know if I feel comfortable putting my football players in masks.
Sure.
You know what I mean? Under a helmet, or in the gym playing volleyball and all that stuff. So I'm just.
It's a good thought.
Just a thought. 'Cause I know that's going to be another question that would come up. So. And I'm all for masks, so I'm not saying that I'm not, but I just think that if we're doing this, then we have to think about activities and how do you have band. You can't play a musical instrument or sing with masks on, so we just need to make sure that we're thinking about all that as well.
So my gut reaction is we have done a really good job of trying to make our decisions anchored in the guidance we receive from the professionals that write that guidance. I'm assuming that guidance that you talked about getting in regards to fall sports will have some recommendations in there, and I think we can review those as they come and determine if we want to anchor to that or be more or less stringent to the guidelines that they provide. But I think if we really kind of stay true to what we've done and root our decision making in the guidance we receive from the experts, I think that will prove beneficial to us. So I think it'd be hasty for us to say a decision now on that.
100%.
Yeah, but it's a good thing to have in the back of our minds as we get that guidance, how do we apply our mask policy to that?
And I think, quite frankly, it's going to be, and I think what they'll weigh in is that harm benefit factor. Throwing a mask on a cross-country runner and saying, wear this for 3.1, there's not enough benefit there to outweigh that harm. And I think that that's probably what they're going to look at is, what's the harm benefit for any mitigation strategy that you're using. And so I guess I would reiterate what Suzanne is saying here. There's times where that's not the tool. It's not the tool. It's a tool. And so thinking that we're going to rely upon that as the great fixer of what's going on in our schools, I think it comes back to what Troy said. It's common sense and spacing and using our green space and making procedures as a school, because you guys are right boots on the ground, know how a school runs and how your building runs, to minimize, not eliminate. Can't eliminate, can we, Suzanne? We can't eliminate anything, but we can certainly minimize exposure with these tools. So, and I think the associations will do the same thing. So, Dave?
I'm fully on board with first grade on requiring masks. I have some question marks about kindergarten.
Okay.
I have a 4-year-old grandson coming in and can't see it. Can't see it.
Not that we shouldn't try at the kindergarten and preschool levels when appropriate, but definitely on board first through 12.
Okay.
One light bulb moment for me in the IASB conference on Wednesday was, and administrators and nurses take this in, do we need to focus on having clear masks for teachers for those students that are hard of hearing or English as a second language? That was one I hadn't considered, so we need to look at face masks or something, or the masks with the clear piece in. That's
When we do one-to-one,
thing
some one-to-one instruction, maybe something.
Right.
Something. You bet. You bet.
Thoughts over there, Tim?
Actually, I got a question actually. I'm on board. I think we definitely put most of the power in the teachers and the principals. Figure they're going to be at lunch, be mask free at that time. Definitely take advantage of the outdoor opportunities and train. We can actually start training them so when the weather starts to get worse, that they might be able to do a little bit more.
The tolerance level.
Tolerance level
Yeah.
for the kids that, for the day when it starts raining out, as you know, the kids start getting cold. I did get a text from someone, how we're going to handle kids with special needs.
In terms of
Where the needs.
I mean, that'll be a case by case, obviously. I mean, I wouldn't want to equate special needs with not being able to wear a mask. It just kind of depends, but I think we would, that'd be a
And that's a
conversation.
little bit about what I talked about. There are different behavior strategies that are there to be able to desensitize students. Should I come up?
Probably.
There are different strategies used to be able to, behavior modification to be able to desensitize students to wearing masks. I think, when I've talked to my teachers at Grandwood, I have the conversation that we're going to have a soft start to the school year. I think one of our soft starts to the school year is going to have to be the fact that we may not have 100% of our students wearing masks on day one. I can guarantee we'll have 100% of our staff. With that, though, it's going to take us some time to be able to work with the students to be able to get them to the point where they can feel comfortable with that. So I don't think that that's just specific to Grandwood. I think that that's specific to
I think that it's
any of
case by
those.
case.
Yeah. Yep.
When they're needed. I think the other thing, and I'm going to kind of go back to what Dave said, I think the other thing is, look at the commitment, the WGEA and that. If kindergarten teacher said, I tried, huge fail, harm benefits just not there, I don't think we should be wearing masks. They're professionals. I'd definitely take their recommendation there. Because they're committed to that.
It's important to have a progressive discipline policy in place regarding masks. More stringent the higher up we go grade-wise, so that, as we teach kids to use those masks, at some point we kick in disciplinary policies as well.
Yeah, I'd like to believe we can kind of, through that, hey, this is the culture and responsibility and respect and some of those kinds of things is more of than a punitive approach, but we got to work with those families absolutely and meet them where they are. So.
Alex, did you have a question back there?
Yeah, no, I
Or it's
think
more of a
at
statement.
all levels, everyone's buildings, it's gonna take some education, even with adults, how to take it off the correct way and how to not be touching it. That's definitely something we can all help with. A lot of videos and stuff coming out, different age levels, teaching them, fun little videos on one of the big things still in the spring was kind of the T-zone of not touching different parts of your face. Just like if we can incorporate some of that, we can definitely help the teachers with that kind of stuff too, so.
Sure, I think that'll be a great partnership.
Anything else on? There's Nurse Alex.
Mr. Brumand.
I've just got one more. And I know Suzanne couldn't follow up on it, but I'll be anxious to see what the guidance is on music.
Yeah.
Because when you have 20 first graders in a room singing to the loudest of to the best of their ability, I just know what that looks like, and I know what Mrs. Gertis does in terms of movement, in terms of sharing of instruments, in terms of, so that got, and I know it's July, it will change by August, especially when other states are opening August 5th.
Yeah.
And they will essentially be our
We have
watchdogs.
the benefit of not being the test
Absolutely. August 5th will come really quickly for those people
Yeah.
in Florida.
She's been texting me.
Oh, has she? Okay.
There was some guidance that came out too on kind of our nurse.
Alex, you want to come up here really quick?
Oh, yeah.
I think people at home are interested in this.
Okay, sorry. There was some guidance that came out on our kind of school nurse listserv, so we're all a part of a group that we can share emails. The leader of the Iowa School Nurse Association sent out like an Iowa high school music guidance thing. So there is guidance coming out, so hopefully that we'll just keep getting recommendations.
I've kept my mouth closed because I can't speak intelligently to it, but it is out. And ironically, they talk about cutting a slit in the mask and playing your instrument through the mask, which I just don't quite understand that. But there's some guidance out on that, and how big of a group to bring together, and maybe go outside when you can, and yeah, there's some guidance out there on that.
I'd say kind of, we've joked about this, but staying true to guidance as much as possible, I think, has served us really well in our decision making so far. So if we can continue to do that, stay true to guidance when it makes sense. I think that there may be a time where we need to deviate that for whatever reason, but if we can just kind of anchor and root to guidance, if at all possible, I really think it'll help us in our decision making.
So ironically, Alex is on there, and she stole my thunder. So on this slide, I was going to talk about the nurse's office being for the routine first aid and just the routine nursing stuff, and having isolation rooms and how important that is. Boy, when we call a parent and say, boy, your child is exhibiting symptoms, because we've talked to your child and they have these symptoms, shortness of breath and a cough, and they have a fever, we need them to come pick them up. Not 2 hours later. I think the nurses talked maybe 30 minutes was maybe reasonable. Is that reasonable, nurses? I see them shaking their heads. Okay, and so I think that's really important when we talk about managing the students, that when they are ill, we need to get them out of the building. So that's important there. Can't say enough. I thought it was a big ask, Suzanne, for you to be here tonight. She stayed with me to make sure I don't say anything I shouldn't, I suppose. But I'm really looking forward to the relationship with Dallas County Public Health and walking hand in hand in this. I imagine that the phone rings and it's like, let me tell you another scenario. And did you notice how she didn't miss a beat? Okay, what do you got? Because I would imagine you've probably heard just about every scenario. Not yet, but you've heard a lot of different stories. And so I think recognizing and knowing our families and understanding the situation, recognizing that it's going to be different depending on the situation, and just reaching out and having that conversation is going to be really important, and I value that. Oh, Rob stepped out. It looked like his back was hurting him a little bit. Study hall, I talked to Rob a little bit about this. Jake, maybe you can help me with this one. I think you try to cluster study halls at the front end of the school day, or maybe the back end of the school day. And so if you have a study hall and you're passing all of your classes, maybe Mindy, you can help me with this one. And I need help here. I'm flying solo. You don't necessarily have to come to school until...
From what I understand from the high school, yeah, because we already have that with our seniors anyway, and then our juniors that take BMAT classes usually is opposite of study hall, and they don't come in. I would assume ninth grade now.
Yeah, and then on the back end of the day, same thing.
Yeah,
if you have
so
a
they
study
can leave
hall,
early.
you can leave early, and so that would definitely be a way to kind of mitigate the number of students in the building. And then also, I think I challenged them a little bit about thinking about a space that could allow for people to spread out a little bit. I'm kind of in Dave's camp. You and I had this conversation. I think keeping them under our purview, under our eye, rather than them wandering around, or quite frankly, sitting in their car waiting for the next period, because it's not conducive to go all the way home and come back during a 42-minute period. So the chance that they might just be sitting around in their cars. So why don't we just create the conditions in the school? So that's kind of, we went a different direction there. Now, with all of this said, later on in the meeting, we're going to look at a board policy. It's 501.91, and it's a request for remote learning. I recognize that there'll be students that either being medically fragile or different needs that may want to elect to learn remotely. And so there is board policy from Iowa Association of School Boards I'm putting in front of you, and I think we need to have that conversation. I was thinking we might want to limit it to just the families that have, whether the child or a sibling or a parent in the home. But after that proclamation on Friday, it kind of talks about that condition A, if you remember the proclamation, that if parents request. And quite frankly, that's, Christy and I were kind of talking about this on Friday. I think that can almost become you're on site, but somewhat of a hybrid. If a certain number of hybrid learning, if a certain number of families are electing to be home, it creates more space in the classroom. And so we do need to talk about that as part of that proclamation from the governor on Friday.
Hey, Dr. Adam, can I ask a question on that real quick? Just on that is, if you're a teacher, and a student does request to have a remote learning or, web learning, if I'm the teacher for that classroom, are we going to set up something like a webcam, in the back of the room to film it? Or am I expected as a teacher to teach for 8 hours, go home and do that same lecture again that night?
Yeah, I'd say work smarter,
Yeah.
not harder. Even and I could create all kinds of scenarios, Andrew, and I've been thinking a lot about this. Let's just say you have 15 second graders, for instance, that choose remote. I'd probably pick one of my second grade teachers and say, you're the remote teacher, and then distribute the rest of the students, so now they're focused primarily on that. Cody has promised, between Cody and Jamie, we've got a couple of classes lined up, and the instructional coaches are going to be instrumental in instructional design through Seesaw and instructional design through Google Classroom. He's promised me that you can do them both with one shot. And so really planning on working smarter, not harder. Do I expect you to work time and a half now? Do I expect you to go home and, I think it's about creating the conditions to meet both of those. Does that make sense?
Absolutely.
Okay. Boy, I felt before Friday and before my Zoom meeting today, I felt comfortable telling you what I was going to say about building closures and district closures. But I feel like they pulled the rug out a little bit in terms of, I think we got a great sense of what it's going to look like for the individual student, and doing the contact tracing with Dallas County and giving guidance on who should be isolating because of the illness and who should be quarantining because they were exposed to the illness. In the proclamation and what I heard today, Iowa Department's going to play some kind of role in deciding, does a whole building close and does a whole district close based on an outbreak. Am I characterizing that correctly? Am I close?
I haven't seen the guidance, if there was new guidance today. What I am aware of is, yes, that the input will come from the school district, the local public health department, the state health department, and the state department of education. And that would be a conversation to be had with all 4 entities participating.
So I think they said the 1st of August, or the beginning of August. So hopefully, we are talking about a special board meeting on August 3rd. I'd like to believe I'd have that for you on August 3rd. That I just don't have clarity on. But I do know that an individual student could go home due to COVID and isolate. I do know we could end up sending students and adults home to quarantine because they've been exposed to somebody with COVID. I do know I might have to send a classroom home because we couldn't pinpoint the number. And I know Dallas County is going to help me with that. And then I do know that there'll be a case where at some point, Suzanne and I are going to meet up with Iowa Department of Public Health and others to talk about, do we close a building? And I've been told, Suzanne, that if we close a building, the rest of the district remains.
It can.
Yeah. Can stay open. And then I do know that there's a situation where maybe the whole district will close. Suzanne, we talked a little bit about 10% absenteeism for closing.
So currently, with other diseases, with other infections, if a 10% absenteeism rate is reached in a school, then it needs to be reported to the state. We had a meeting with the superintendents in the county, and I suggested that if you're at a 10% absenteeism, and it doesn't matter if it's isolation or quarantine, then you probably want to start having conversations and bring in public health and maybe the State Department of Health, because 10% is a pretty And that is 10% of students. It does not count, at this time, the way that the guideline is written, it does not count staff. But if you have 10% of your staff gone, you probably have to close anyway, simply because you won't be able to have school.
So more to come on that. So I guess just to that was my last slide. So just to kind of package it for everybody, and I do want to share what I'm calling a very inspiring story. I want to show you, those of you that know me, know I'm a storyteller. I got permission to tell this story, and I'm going to use the names, and you might even know them. So I had an opportunity to talk to a just wonderful mom, Stephanie. I've talked to her a number of times during the closure. I've talked to her a number of times during the summer. And her little boy, Paul, he's delayed. And when she says that, I mean poor fine motor skills and intellectually disabled. And she said, you know what? Since March 12th, when we closed, she says, Paul is not a remote learning sort of kid. He was left absolutely behind. Not only was he left behind, but he started with self-injury behaviors and just really confused and just was, he was a handful. It wasn't fun. I checked in with him because I wanted to know how things were going. He started extended year services 2 weeks ago. Self-injury behaviors are gone. Paul's the kid that Paul was before this closure. So we got to fight for Paul's. We got to fight for these students. We know it's been detrimental to not have students in school. This guy right here said, it was hard. It was hard to say we need to close schools for 3 weeks and 2 weeks and for the rest of the year. It was hard for teachers. I have a daughter that teaches school. I have a wife that teaches school. I've heard stories from these teachers. They want to be back in front of their students. But we've got to do it in a safe way. And I think the mitigation strategies that we talked about tonight, the conversation about masks and the tool that it can serve to allow us to get students back in front of us, I feel like this is that we can have, Ashley, I'm going to say it out loud. We said we're going to say it out loud. I believe we should be in school August 24th in the building, on site, students in front of us, and use these mitigation strategies that we talked about tonight. And work with our teachers, refine them, change. Our teachers are best at that too, changing something that doesn't work, refine it again, evaluate, refine, and it's a constant evaluation and implementation and adjustment. I think we can do it. That's my thought. I see some head shaking.
So, with Dr. Adams just presented us a ton of great information. Say it again. We plan to be in school, in the buildings on August 24th. I know parents, people in our community have had a lot of questions about that. That's the plan. This conversation has been about what does that look like and how do we do that safely for our students and for our staff. I think that we have a lot of really great plans in place, but I think we would be foolish to say there aren't still questions.
Absolutely.
There are going to be questions up until August 24th and beyond. So I think the ask is, this is a team effort, right? It's us, it's students, it's staff, it's parents really working together to ensure that we're creating that safe environment. But I also want to make sure that we've answered as many questions tonight as we can. So we've received questions from the teachers unions, from some parents. So I just kind of want to go through some of them that we maybe have not answered and have any dialogue about that, and then any other questions that.
Can we start with Kim? She's been very patient.
I've got her email up
Okay.
here. But Kim, do you want me to just kind of take through it, or are there anything specific maybe that you might want to come up here? Sorry.
Another question that I had, and I don't know that it's specifically on that sheet, but like, when we
Can you come up to the mic so people at home can hear you? I'm sorry.
No,
They
that's
probably
fine.
have the same question you do.
Maybe not. Maybe I'm just crazy. I don't know. When we closed the schools in March, our testing to positive rates was 9%. Today, our testing rate to positive is 9.3%. So I guess I'm not following. Why was it so bad in March that we needed to close down the school, but today it's safe enough to open? Statistically. If the numbers are the same, I mean, we're more cases, but percentage-wise, we're the same.
So Kim, I don't think that any of us sitting in this room are able to answer that definitively.
Sure.
Other than to say that we have to trust our experts. We have to trust the guidance that we're given, because none of us are physicians. None of us are county health professionals. We have to trust the guidance that's been given to us.
Sure.
And make the best decision as a whole with the guidance that we have. At that time, the guidance was, you got to close your buildings. I
Sure.
think now with more understanding, more knowledge, more risk mitigation efforts in place, we're able to answer to a different set of guidance. But none of us know for sure. I think that we have to trust and believe that the subject matter experts have vetted the information. We have vetted it against our abilities as educators and leaders within Woodward-Granger to apply that to the best that we know how to do.
Sure.
That's the best answer that I can give sitting in this chair. I don't know if anybody else has any other.
So during a superintendent or Department of Ed Zoom meeting in the last 30 days, Dr. Pedati was actually on there. And one of the things that she said, and Suzanne, you may have a better answer than the rest of us, but one of the things that she said on there is what they know now about the virus is way different than what they thought
Sure.
they knew about the virus at the beginning.
Right.
And recognizing, and actually, if you look at you can actually have my copy if you'd like, the American Association of Pediatrics, but they're kind of saying the same thing. What they're finding out is that heart conditions, lung conditions, age plays a bigger role in it than children.
Which I understand, but with children being somewhat quarantined over the summer and from school, you kind of wonder about that data as well.
Yeah,
Children have been somewhat isolated
Sure.
over the last 6 months.
Yeah, and that's kind of what she said about we just know more. We just know more. And we're not saying you made the wrong mistakes in the beginning. We're doing it right, or we were doing it wrong, or whatever. But just we know more now about the virus,
Understand.
so the decisions they're making look different. And I'm in Ashley's camp. I mean, they're the health professionals,
Right.
and whatnot. Suzanne, do you have anything to add to that? Or?
No, I think what you just said is what I would have said is that they've just learned a lot over the last 4 months. And I think they're basing their decisions and their guidance on what they have learned. And back in March, we really didn't know anything. And so we just cut it off to be as safe as we could be.
Is the CDC guideline still the 10%? I know that they've said like for shutdowns and things like that is the 10% testing, because at 9.3, that.
That one I don't know off the top of my
Okay.
head. I know that the CDC guidance has changed. It feels like to me every week.
Sure. Seems like every hour.
Yeah. But I really don't know that they have a specific percent out there for
Okay.
shutting down in particular schools. I think they're really looking at different populations with different strategies, and schools are certainly one of those populations.
I'm definitely on board with the masks to school. I'm not sure that I'm comfortable sending my children back at this point, to be very honest.
Well, we do have. You might want to stay put then and listen to the board policy that we have.
Okay.
That I'll be sharing here.
But otherwise, yeah, probably just the questions that are on the sheet.
Okay, so I'm going to tick through. Kim had sent the board a series of questions. I think we answered a good amount of them. Bear with me for just a second as I'm reading through to determine if I missed anything. One of the questions, will additional custodians be hired to keep the schools sanitized? And what additional steps will be taken during off times when students and teachers are not in the buildings?
There's actually an agenda item about additional staffing later in the meeting. Yes, the answer is yes, we need more help.
Talked about lunch. So maybe a question about lunch. We've talked a lot about what Taher will provide. Are we still comfortable with kids bringing cold lunch and bringing
Absolutely.
something from the outside
Absolutely.
in?
Just like
Okay.
bringing water bottles And bring in lunch, absolutely. The old days of trading. I don't know if you did that, Dave, right?
Yeah.
You know, trade your
I'll
money.
give you my Jell-O cup
Yeah,
for your
no,
pudding
we're
cup.
We're not doing that.
How will parents be notified about possible exposures? Is it a phone call to everyone? Is it something through Infinite Campus?
I think that's a phone call.
That's a phone call.
That's a phone call.
Yeah.
Were you gonna say something, Kristen?
Have air ducts and filters in all the school buildings been replaced for the start of the year?
Filters, we do filters quarterly.
Quarterly.
As part of a routine. We haven't cleaned the air ducts. I don't know when. I've been here a year. We didn't clean them this year.
Okay.
I'll be frank, that's really expensive. That's very, very expensive to do.
Have we
that.
seen any recommendation that is calling for buildings to do that you're
Well,
aware
I
of?
think normal routine filter changes is very, very important anyway.
Yep.
I haven't read anything that, I'm not saying it's not out there. What prompted that question? Did you read something or?
Just because it's an airborne.
Yeah. Yeah.
It hasn't been completely unprecedented that we've had air handlers go out.
Right.
Do we have any plan to shift the classrooms if they're affected by that?
Yeah, we're pretty quick on. I guess it would. You've experienced that, I know. Kind of an adjustment or.
We have a few empty classrooms in this building that we could adjust and move classrooms to, just depending on what the situation lends itself to. All depends also on. We've talked earlier this evening about utilizing every space that we have, and when we start doing that, that means that we're going to utilize every space that we have. So there won't be many untouched spots.
Will we allow those maybe younger kids who have nap times or just that are younger to bring those comfort pieces from home, blankets, a lovey, anything like that? I know I've got a little one in daycare. They're allowed to take a blanket, but it has to come home every day so that it's washed by parents. I don't know if we need to think about that or what that guidance looks like, so maybe we'll leave that to the BLTs that support those ages to kind of think through some of those things. Similar to and nurses, a similar question to this is also snack. What does it look like? I know in some of those younger grades, they bring a snack for the group to share. So I think that there will be some decisions that need to be made for those younger grades around snack as well. I think that covers all of your questions, Kim. Anything that we've missed?
No, you talk about the benefit, farm benefit. It sounds like they can't touch anything. I mean, when she's going through all the things that we shouldn't touch or shouldn't use, it sounds very limiting to return to normalcy for the students.
And I think, I hate this term, right? But we hear it a lot as this new normal. And a risk benefit is it more risk to have everybody at home or to have them have a kind of a limited experience at school? I don't know that any of us can say definitively. I think we're having to make the best educated decision on that. And, Kim, I understand some of your concerns. I'm sitting here thinking, gosh, is preschool going to look the same for my third as it did for my first two? Probably not. But I do really trust our teachers. I do really trust that it's not going to look the same.
I think everybody's doing the best they can.
Absolutely.
I don't mean it against anybody.
Oh, and I'm not taking it that way at all. But yeah, I think it's just going to feel real different. Yeah.
I think there is marginally I can't count the amount of parents that came and said, how much more I appreciate teacher now. Because when they were trying to help the kids at home, we got 10 years of education in our house, we struggled. We did the best we can. And the teachers are teachers for a reason. They love their time. So we do have some parents that would say, well, are they getting what they're going to get at school? Probably not. I can tell you right now. So I appreciate what teachers did because those 2 months
Or hard.
I don't drink. That's probably the closest I ever came to drink. Because, Logan was great, a great he's still struggling with some of his homework and with the struggle in the school. And that means a lot to me. And I know you have all teachers out there that do what you do. So parents do want to stay home and teach their kids. It's also do these struggles.
Well, I don't want to.
Yeah.
I'll
either go out.
I don't work too. I mean, I have jobs too. It's just,
Your concerns are really valid. I hope you're not, I hope you know that I really appreciate your concerns. And you brought up a lot of things that I think have been thought-provoking for us and things. So I appreciate that you have that, such a vested interest, and you've shared that with us. I'd love to shift to some of the staff concerns. Maybe check through some of their stuff. Is that okay? Feel okay? You've talked about it. We've got a lot of PPE. Dave's ordered a ton of masks, a ton of shields. We've got PPE. How about disinfecting and cleaning supplies? Will
Lots.
they be provided to the staff? Do we feel like we have enough to give to the staff to adequately clean?
We've ordered a lot.
Okay.
A lot.
I know every parent's school supply list is a box of tissue and some Clorox wipes. Those are tough to find these days. If parents can't supply that in their school supply list, do we feel like we have it covered from a school perspective?
I can't speak to Clorox wipes.
But
Absolutely.
an equivalent to disinfect and clean service.
You bet.
Does that answer that question?
I do actually have a question. So there has been some guidance from not our union, but other teachers' unions that have told teachers not to purchase materials, cleaning materials for classrooms because they could open themselves up for a lawsuit. I mean, how do you guys feel about that? I mean, I've been looking at the EPA list for very obvious reasons for my personal health. And I do have some of those materials at my house that are on that list. I personally do not have a problem providing those things, but how do you guys feel about that?
What they're talking about, you need to have what's called a safety data sheet. Anything that's in your building needs to have a safety data sheet. So that would just be a matter. What we don't want to have happen, what they're getting at, that language is kind of strong, but what they're getting at is you really can't be using anything in your buildings that doesn't have a safety data sheet. So it might just be a matter of getting a safety data sheet on that product.
Okay.
Just occurred to me that we might have an issue we need to think through a little bit more at the secondary level. We're talking about having the staff out in the hallways during passing times, which I fully support. Who's disinfecting the desks, et cetera, in the classroom?
I think that'll have to be something we do while the kids are still in there, and where we dole that out the last 60 seconds, can we wipe it down? So that will be a hard piece there. How quickly can we do that and then get in the classrooms? But also you have that 2 waves of classrooms as well. Maybe we hand something out as kids are coming. I don't have a great answer for that, but I would like to try and get both done.
We did talk, and I don't remember which group I talked to, but the students helping, again, not in a punitive way, but a responsible way. So that last 60 seconds might be, hey, wipe down your touch server, your desk, or your bell ringer. Mindy, could be clean your desk. That's not much of a bell ringer, but I think it's about being creative and with your resources.
I would just have a desk in the hallway for myself. I just put there. I don't know.
Will our secretaries be able to confirm that a student has been picked up by their parent? Because it's not always easy for them to always view that from the pickup office, or view that pickup from the office. And kind of on a similar scale, will our secretaries or other staff have to escort students to pickup locations?
I don't think escort. My first immediate response is I hope that's what we're doing in current practice, not just COVID practice. As a former elementary principal and just as a principal, I'd like to believe a student would be in the office and mom comes in, gets into the foyer and release. I certainly hope we don't have kids waiting out in parking lots, waiting for moms and dads, to pick them up. So I think it's a student management piece that I would like to believe or wait in the, whatever. I mean, you're in the buildings, wave, hey, knock on the glass, wave from the foyer, mom and dad are here. Or we say, parents, give us a call, we'll release your student when you step into the foyer. I mean, I'd like a clean handoff, and
Yeah.
that's even before COVID.
Sure.
We should be doing that.
So maybe leave that to our BLT teams to really come up
Yeah.
with a strategy for that, depending on the different age levels. I think that will have an impact on how that's played out. When a teacher is absent and we're unable to secure a sub, will we be splitting up the classroom of students as we've done in the past, or is there an alternate plan in place?
And I would have to rely upon what says as we've done in the past, so I'm not familiar with that practice. I'm guessing it's at an elementary level. Again, I would leave that up to Matt and his BLT. How do they want to handle that? Do they pull, the Title I teacher? Do they pull the guidance counselor? I mean, that's a kind of a staff management piece. I do believe that with what you're going to do with instructional design through Google Classroom, my hope is that post-COVID, we're able, remember how we kind of talked before COVID, we kind of talked about the instructional minutes that were lost because we didn't have subs, and the planning time that we stole from our teachers because we had them cover classrooms. I still want a solution for that, and I believe what we're going to learn about COVID may potentially be that solution. But when a teacher's out of class, they've already built everything in Google Classroom, and instruction isn't lost. Instead of the traditional, Mindy, lesson plans that you wrote when you were ill, it probably just looks a little bit different now. Now, I'm not saying we're ready to do that tomorrow, but that's certainly a target that I would like to see us get to. And I think that this is what the instructional coaches have put together, I think it's a vehicle in order to be able to do that.
And that is definitely something that, with Cody and Jamie, Lori and I are working with it too.
Yeah.
And definitely where we can, if we have to, and that's even with the closure. I mean, I'm kind of excited. The one thing the governor said that I actually was kind of excited about was the snow days. That is something I was so excited about when we had to switch in March and go online. The one thing I kept saying is, oh my goodness, if we can do this, we will never have another snow day again. Because we could do something. I don't know if my fellow cohort, I'm just sitting there going, that is the one thing. And that is one thing that even when we were working together and we're trying to get something up with the staff is whereby having that flipped and blended learning that, and this kind of goes on what Andrew had brought up, is it shouldn't be doing twice as much. So what we're doing in the classroom is still accessible to those students that are home. So we can help the parents that are at home without doing double duty. And so we should be able to incorporate some of these tools and some of these instructional designs that will work both in the classroom but also at home, whether we are back, and I don't know where there's actual wood. Let's hope we get a stay and we don't have another March.
Yeah.
Somebody knock on it. But if we do have another March, like we did, what we will be doing in the classroom, hopefully, will be an easy transition at home, whether it's hybrid or full online. And that's been a focus that we've been trying to get ready to do to get to our staff at least by August 1. For some training at least for that.
And I think, if there's one good thing that came out of the sudden closure in March is we learned a lot real quick.
Yes, we did.
About how to do that, right?
Yes.
You guys did an amazing job of pivoting quickly and responding to the needs of our students, and I think we're only gonna get better at that.
I know, and then maybe no snow days
I mean-
ever again, and we can actually get out on a day.
You always know.
We're using those.
Sometimes you need a snow day.
Well, I realize it's not that we're teaching online. Oh, Dave. It's not that we're sitting in front of the computer teaching.
End of February, you need a snow day.
You're killing me.
The kids need a snow day, but I think that it's nice to have the tools, for sure.
Absolutely, yeah.
This is a question that's it's near and dear to my heart. It's, how do we support our staff members in balancing what's happening in their personal life with what's happening here at school? In my opinion, there's not a one-size-fits-all answer here, other than we lead with compassion. And I think if we keep that in the forefront of how we're making decisions and how we're responding to people, that will help. But I would be foolish to not recognize that it could potentially be really hard for some of our staff members. And we just need to lead with compassion. I don't think that there is a one-size-fits-all answer there, other than a commitment to listen and learn and lead in a way that makes sense, because everybody's situations are going to be so different. I don't know how else to answer that other than to support
Yeah, I
our
think
people.
it's knowing our people and having conversation with the people and, hey, what do you need? You know,
Yeah.
and I think that that's really important. I hope staff members will go to their principals. I think there's plenty of reasonable accommodations that we can make for people, and we need to make those accommodations. I want teachers to feel, you know, safe and feel good about being in that building with students, and so we need to make decisions to help them with that. So I do want to talk about, there was an online question about Hawk's Nest, and I do appreciate that question, because I failed to say we do have some success stories and some things that, you know, we can kind of lean on, and that's Hawk's Nest. It's actually been in operation since June 8th. Now, granted, it's not apples to apples, it's smaller groups and managed a little bit different, but we've had a lot of success. I think the question is, what happens if somebody with a second grader you know, has COVID and they're also going to the Hawk's Nest? And I think I can answer that, Suzanne. Just shake your head. We do the contact tracing and find out that there was exposure within the Hawk's Nest as well, and then we would respond accordingly. Okay. Therefore, cohorting in Hawk's Nest is just as important, because I'd sure hate to knock our whole staff out and then not have that valuable resource to our families. And so, great question. That was on the live deal. I'll talk to Jill a little bit about the power of cohorting and maybe working with principals to ensure that there's some cohort grouping to minimize the number of exposures. Great question.
What is the plan for cleaning toys, shared items, classroom books, devices, etc.? I think the plan is to follow the guidance, whatever the guidance tells us to do there, to make it as rewarding of an experience for those kids, but still a safe experience. And I think we just anchor back to what the professionals tell us to do. And I'm guessing that will look different on August 24th than it looks today. So I would say we probably doesn't even make sense to go through it all now, because it'll probably be changed 17 times between now and then. But I think anchored to guidance, and I think, you know, Matt has challenged Dave Smelter to ensure that his custodial staff is up to date on what the recommendations are, what the guidance is, and ensuring that that's being monitored and implemented appropriately.
You know, like Christy, I don't know if that came from you, but I'd like to, you know, in doctors' offices, they have all that stuff. I'd like to believe that they're disinfecting, or even child care centers, and they may have some tips. You know, I know they fill, you know, buckets with a bleach compound and dunk things that can be dunked, and some of those, so.
There are some really good resources that Matt can share with the preschool team about return to learn.
Yeah.
So I've been reading some of that.
Okay.
They talk a lot about soap and water as well. So.
Oh, Suzanne's shaking her head, so the power of soap and water is still there, huh?
So we could use our water table as a cleaning table instead of a water table.
Learn how to scrub.
Yeah,
this
today's
fake
session,
fruit.
you're gonna.
Yeah. Another question here is about sharing lockers. I think that that's kind of a takeaway from this meeting, is to explore what that could potentially look like. To be honest, that wasn't even on my radar, but I think that that's a great thing for us to consider. So kind of a takeaway for the BLTs is to figure out best practice for your buildings on that.
Yeah.
This question is, there is a possibility of athletic and music seasons, plays, etc., not happening. So if that's the case, will our coaches still be paid? So as of right now, the plan is for those things to happen. So obviously they'd be paid. I think that this board has shown that we are committed to ensuring that when we can, we will, in terms of paying and supporting the staff that takes on those extracurricular things. As I sit here today, Ashley, just me, I'm committed to ensuring that that happens. I think that we can't ever speak in definitives because you just don't know for sure what the circumstances will be like. But I think this board has proven that we are committed to supporting our staff. There. Am I speaking out of turn here? So,
Ashley, can I just touch on that?
yes, please do.
Some of our coaches elect to get paid over 24 months. So some of our winter coaches have already been started getting paid.
Right.
Okay.
So the question that was posed to me was, do I need to put that money in a separate account to pay back? So I think that's kind of where some of that concern comes from. Because it's not lump sum. Some
Sure.
get the lump sum in the season, but others get it over the whole year, so.
That's a great point, something great to think about. I'm going to speak for myself here and not as the board whole. My opinion would be that I would not advocate for ever clawing money back from someone. That does not, that acts in complete opposite to our commitment to our employees. That's Ashley's opinion. And we've already budgeted for that money, for what that's worth. But I think that would be something we would have to touch when we get there. What is the protocol for staff absences? Administrators, Matt?
In terms of, I guess in terms of what?
I'm assuming staff gets a certain number. I know staff gets a certain number of sick days throughout the year. What if they get COVID?
We actually have board policy on that tonight. And so teachers, if you recall, all employees, on April 1st, sent out a poster on the Family First Coronavirus Response Act. Kind of outlines that if you get COVID, 2 weeks, you get 2 weeks paid. If you, I don't have it memorized and I apologize, it is in policy, but if you have to take care of somebody or your child's school closes as response to COVID, I think it's 2/3 if I'm not mistaken. And so, yeah, there's leave, there's additional leave. I'm also putting in front of you tonight some board policy on what I call FMLA on steroids. It's specific to COVID. It's 10 weeks of FMLA just for COVID related. Let's say, for instance, you go to your doctor and the doctor says, you're not going back to work until this thing starts looking a little bit better. Then there's that leave as well. I think I was talking to somebody, and I think the doctor made the comment, boy, you can run out of that. So definitely we got to be very sensitive and make sure that what can I do, what can our principals do, is make sure we put some accommodations in place to minimize that exposure for these employees. But there is that leave in the event that they need it.
Will each teacher have a touchless hand sanitizing station in their classroom? I don't know that we've committed to a touchless.
We haven't. That must be somebody from the H1N1 days. Do you remember that? Yeah, I was a teacher at the time, and I think I was a principal at the time. And those stations are not that expensive. We can certainly look into them. We hadn't talked about that. If BLTs start talking and saying that could be part of, I think soap and water, because if I recall, soap and water beats hand sanitizer every time. I think and correct me if I'm wrong, Suzanne, I think I would probably commit more to washing hands than I would, grabbing.
Soap and water is the preferred method, but if you can't get to a bathroom, then hand sanitizer, 60% alcohol or greater is acceptable.
Okay. We definitely be open to that, but I think they need to have that conversation at the building level.
Will all staff and students be provided with face masks, face shields, PPE, et cetera, as needed by the district?
We like I said, we currently own thousands of masks, and we could do that. I'm hearing more and more stories about people color coordinating their outfit. Matter of fact, there might have been a principal at graduation yesterday that chose his mask to match his suit. Hypothetically.
And also one.
Jake, I didn't point it out that it was you. So we have actually had a conversation with somebody local about putting together Woodward-Granger masks. It's got hashtag WG Futures, so you know she had me hooked right away, and some of those. I think Kendra and I were talking about that. Even I think it was you and I talking about even designing a mask. There could be a mask designing contest, and that we make the mask, we produce the mask of the person, the winning person. I get the sense, I've talked to so many people. Today was even, they're making fun. They're making fun out of it. I think absolutely we would provide the mask, but I really see kind of a response from kids kind of want to take some ownership on their own, and staff too. But yes, of course, we would provide that.
So we can supplement any needs
Absolutely.
that families
Absolutely.
have, staff has.
Absolutely.
But they can and are encouraged to get creative with it.
You bet.
Some of these other questions have been answered. I think the last kind of two questions are really around substitutes. How are we ensuring that we're keeping substitute teachers in the loop with our procedures and protocols? And then have we given any consideration to hiring full-time subs or floating subs that can help fulfill the district's needs? So
I'm sorry, he was
just
showing a question.
quit talking in the back of class.
No, I was helping answer a question online.
I'm just kidding. This is about subs. How do we ensure that subs are up to date on our policies?
I would love to, as we get closer, have a substitute teacher meeting. Bring the principals in. They can talk specifically about the nuances of the building. I would definitely commit to that. We want subs to not miss a beat. And we do have a lot of regular subs, so I think we could identify those individuals. But I'd love to have a meeting. I'd host it. I'd want the principals there.
Any thoughts on employing or hiring full-time subs?
We haven't talked about that. I'd be open to it.
Maybe explore as needed.
We can explore as needed, yeah.
So I think that covers the list that the two of you sent me. Is there anything that we didn't talk about that's on your list? Nurses, admins, Becky, Matt? Okay. We've covered our exhaustive list of questions.
And then one of the things that we did come in, I hope you heard me say that, is August 3rd. I'd like to have a special board meeting on August 3rd. It kind of splits between now and August 17th. I would really like to, another challenge to the principals, I'd really like the principals and representatives from the BLT to talk about the ground that they covered from what we just described to where they are on August 3rd. I think that's fair. We need teacher voice on this. I said it 3 times now. Your boots on the ground. You know the nuances. You're the ones that operationalize all of this in the building. You're the ones that are going to be able to evaluate and refine better than any other. So let's commit to that, principals. So, what are you looking at me like that for, Matt?
Yeah, we'll have a BLT meeting that afternoon. It's going to be
Okay.
fresh.
There you go.
So did you get that, Rob? So August 3rd, I want principals and reps from their BLTs to come in and talk about the nuances of their building and the refinement that you made from what we talked about tonight. That sound fair? So Mindy, Lori, you may be back.
I'm able to.
I was just gonna say, let's get the band back together. Suzanne, anything that we've missed, something on what I presented that I've missed? Is it probably one of the most comprehensive lists you've ever seen?
Now see, you're just maybe.
I'm teasing you.
It's been an adequate discussion.
It's been an adequate.
There we go. Okay. Good. Well, let's talk about, I think this naturally leads to summer school because we're going to get an opportunity to test some of this out. So what's that look like?
Yep, and so I'm gonna kind of turn it over to Matt. We've committed to summer school, August 3rd. I'm teeing the ball up for you.
It's a big day.
Yeah, it is August 3rd too, isn't it?
It's going to be a busy day.
So obviously some of the things that we discussed here, I think are some things that you need to implement.
Currently, right now, summer school is to begin August 3rd, 8:30 to 11:30 every morning for 2 weeks. That will lead right up until the day when, or it ends the Friday the 14th, and new teachers start on that Monday. So we're going to be there. Currently, we have 33 kids. Lauren Holmes and Kelsey Christensen, my instructional coaches, have called all of the eligible candidates of kids that are going into first grade through going into fourth grade that were not meeting benchmark with the fast reading assessment. It is a literacy focused summer school. Like I said, we have 33 kids and we have 5 staff members that will be teachers. So you can do the math. We'll have about 6 kids to every adult. We have 9 that have requested bus transportation from Woodward. That's about on par for where we normally are. So what we normally have served in terms of summer school in years past is right around that 35 number, and that's exactly what we are going to be serving again. We have kind of pushed it a little bit and said, hey, we need you there all 10 days. If you can't be there at least 70% of the time, we're going to make room for another student, because we've had a lot of asks that if their child met the benchmark in the winter, hey, can I still get my little guy in there because of missed instruction from March through the end of the school year. So we've got a list that we can expand it if we don't see participation the way we needed to. A lot of the time in the past, our summer school kids, they're the ones that need it, but also attendance is sometimes a challenge. So we've stayed out in front of that. The gals just got done calling last week, notifying those parents. We figured if we notified too early, we would forget about when it is. And so we will, I don't know if we're going to send a reminder email to say, hey, it starts on Monday. The bus will be out in front of Woodward. We'll leave at 8:10 that morning and get the kids here by 8:30. Following the guidelines that we have tonight, if they get on a bus, they're going to be required to wear a mask. Following the guidelines that was given tonight, the kids will be wearing a mask, and so will my instructors. So, yeah, I mean, it's 3 hours of instruction on a very small teacher-to-student ratio, but it is kind of our making it happen. We have a few kids that are coming over from Hawks Nest that will qualify for summer school as well. So. Yeah, that's kind of the gist of summer school. At 11:30, bus picks up or parents pick up, and we go from there. So that's summer school. Questions?
Bright shiny with their masks on.
We're going to see. Yeah.
Awesome.
You got it.
Questions on that? So last week, Iowa Association of School Boards hosted a virtual meeting to give school board members the opportunity to discuss and learn about COVID-19 response given our current culture. We were lucky enough to be able to have 3 board members attend that conference. So Dave, Sam, and Tim were able to go. So they're going to use this time, I think Dave's going to lead this to really give some updates on takeaways and what you learned there.
Well, in the interest of time, I'm not going to spend a lot of time. One of the things that I felt very good about is that I didn't hear a lot of surprises. Dr. Adams has kept us well informed, and that's really one of the keys to moving forward is communication and keeping that process working. Harry Heiligenthal was one of the speakers, and he had a lot of good points for us. The board needs to use federal and state guidelines and document the reason for our decisions. It's not enough to make the decision, we need to also have documentation of some of the reasons. And then those decisions well. Intent isn't enough. My sense is we do a pretty good job of follow through on those kinds of things. Two questions that kept coming up all through the conference was, what does the superintendent need from the board, and what does the board need from the superintendent? And I'm pretty comfortable with where we're at on those things. We just need to keep in our minds, can we be nimble about responding when we're asked? Are we available on the phone and by email? Are we ready for emergency board meetings if they happen? And I might suggest that we even think about every other week or every week going ahead and scheduling meetings, we can always cancel them, but it's harder to do the 24-hour posting. So that's something to consider as well. The big sentence that I came away with, and I do believe in my core, is that we need to be flexible and nimble and act with grace. And I do believe that's how this board has proceeded in the past. I have every confidence that's the way we'll proceed into the future with this.
I love that sentence.
Yeah. I did not know much about the FCCRA, so that was a surprise to me with the 2/3 and providing. Now, if we quarantine, there's days, 2 weeks available, but it only runs through December 31st unless it gets renewed.
It's definitely all part of proclamations and different
Right.
things. There's a lot of expiration on December 31st, but if it's still around, it'll still be around.
Yeah. I would hope it would
Yeah.
get renewed, but we'll see. As I said, the board should help the administration by being available, flexible, available by phone and email, be ready for special meetings. Also, for Dr. Adams, we want you to feel comfortable that you're able to call on us for decisions when you need them or for backup for decisions that you make. So you feel free to call on us when you need it.
I feel the freedom.
There was,
Hey, how's it going?
you won't be surprised that there was considerable discussion on masks all day.
Sure.
And the one pickup that I hadn't thought about was the one about clear mouth availability for hard of hearing and ESL students. So I'd like to make sure that becomes part of our thinking.
Yep.
One other eye-opener that I had not considered was there will be vacations, winter break, things like that. Do we need to have policies in place for teachers that travel out of state, students that go to Cancun?
Yes.
So I don't know that we've planned that yet, but I think
No,
we
we
need to
haven't.
plan that.
Okay. That's a good one.
So I'll just summarize my part. As you said, I agree. The big sentence that struck me is be flexible, be nimble, and act with grace. That's how I'm going to guide my thinking in the next 12 months.
Tim, Sam, any other big takeaways?
Well, Dave obviously takes a lot better notes than I do. He appreciated this stuff. I had one I don't have a lot to add. I'm just kind of looking stuff that I had written down.
I think what they talked about is just the teachers, if they're going out, please let the principals know, because if they're going to a wedding or something like that, just be honest about where you're going and stuff like that. And that's kind of what I took away from it, and be flexible for them. And I learned more from the chat, the questions they were asked in the actual briefing. But just be flexible. That's what they talked about. There's going to be changes between now and August. I mean, they said that what we're talking about today might not be good tomorrow. So that's probably what I took from it. And Harry was on there.
He's good. Well, thanks for representing us on that meeting, guys, and the takeaways there. I think that IASB does a really good job of keeping us updated and prepared and providing information. So I'm glad you're able to do that.
There was still too much guidance will be coming on that.
Story of our lives,
I was going
right?
to say, I had a nickel every time I heard that.
Yeah. Yeah, for sure. Let's talk COVID response to staffing
Sure.
needs.
When Luke and I put this together, we were specifically thinking about a couple of different positions, but I think there's more conversation that needs to be had. Alex sent an email and made me go, and thinking about how we're responding with 2 buildings and balancing all of that. And I think that that's a conversation. Definitely, you know the resources that you have in the ELC and in the elementary, and probably have a conversation about can you do it, and if not, let me know. But what we put on here are 2 things. One would be, I don't know if Luke liked the term, but I called it seasonal help. I don't know if you stuck with that term, but basically seasonal help would just be like that, you know, like during the holiday season, you have gift wrappers, and then when, you know, the holiday is over, you're no longer a gift wrapper. Kind of the same idea with seasonal, you have a certain number of weeks that I think we decided, 20 hours we were kind of looking at, where they could come. That's the problem. I don't know exactly how long the season is, but you know, looking at something like 20 hours to do some of the things that we just talked about, being able to be on site and doing some of the routine cleaning, doing some of the touch surfaces. There's just so many opportunities for us to gear up on some of these mitigation strategies with some seasonal help. So we were thinking, we thought, we did the math, and we're thinking maybe about $6,000. So I can't remember.
And, you know, it was really touch surfaces, doorknobs, they walk in the hall.
Panic bars, all the.
High school, you know, they would get into the rooms and very, we could help with that. They would get COVID. You buy extra PPE stuff.
We did, it was the ESSER money, you probably recall on the Friday report, about $36,000. That can be used to offset some COVID-related expenses. This would be a COVID-related expense, so we thought we could use some of that ESSER money for that. The second, I guess I'll talk about the second. Do we have Dave? Did we lose Dave? Is he available? Maybe we can talk about that, and then we'll get Dave on, because I want to get Dave's voice in the room as it relates to the second half.
All right, you're in the meeting.
Well, we're doing it this way.
Yeah.
Let's put him by the speaker. And
You can put him right there on the table. I can't hear you. What? Can you hear me?
Hey, Dave, calm down. Calm down. Hey, do you know you're on speaker? You're on speaker.
in the meeting.
And in the
Can you
meeting.
hear me?
Yep, okay. Dave, what I want you to do is, so we're talking a little bit about a staff response to COVID, and I want you to talk a little bit about the grounds position and what we want to do with that to kind of kill two birds with one stone, okay?
Okay. As far as the grounds position in the past, it's always been a part-time job. We have plenty of ground stuff to keep a grounds guy full-time year-round due to, with the different changing seasons with snow removal and, all that kind of stuff. During football season, we have the football fields that have to be, the lines have to be painted, the numbers have to be done, and et cetera. Can you guys still hear me?
Yep, keep going.
Sorry, I'm in the mountains. Anyway, just for, that part during like this time of year going into the fall sports, there's plenty of stuff for them to stay busy doing. And then moving into, winter, we would have snow removal, through the entire district. As of right now, it was myself and Gordy and Terry doing that. And with, Terry resigning and retiring, now we're down, one individual completely. And, we got Grandwood, this past year. And, that's a building in the past we never had to do with two people or even three of us. The custodians do help out that we have now. They do like the entryways and the salt and that kind of stuff. But, and then with the COVID part of it, we're looking at, if I have a custodian that's gone, maybe on vacation, or maybe we ran into a situation where one of the custodians is, is homesick with this or whatever, we would use that position. That person would be a fill-in also. They could work at the elementary, they could work at the ELC, they could fill in at the middle school, they could fill in at the high school level, and so on. I know myself and Dr. Adams and Luke talked a lot about it here just last week before I left. I know there's a lot more that we had wrote down. I can't think of everything off the top of my head, but.
Well, we talked about a CDL.
Oh, yes, I'm sorry, yeah, bus license. The gentleman that I have looking at this position will be getting a CDL. So that, that right there, as far as a sport, or if we run into a situation where one of our bus drivers maybe can't run a morning route or an afternoon route, or, something like that, where we need a emergency fill-in, he would have his CDL, be able to drive a bus. We have one custodian right now at Grandwood. She's really close to getting hers finalized. And then myself and 2 of the other custodians, once I get back here in the next week or 2, hopefully stuff calms down a little bit, we're going to start getting ours to help with that issue, I guess, too.
And then we talked about light maintenance as directed by you.
So like, I can't be everywhere at once. Cody and I are, seems like we're everywhere, but we can't be. So for me, if I'm at the ELC doing a water leak or something where I need extra hands, because a lot of times I don't have help. Well, so now with needing more custodians, for the cleaning, I really can't pull a custodian away from a cleaning. Or maybe they're cleaning the high traffic areas during the day. From handrails to door panic bars to whatever they could be cleaning. I can't pull that person away from that job and say, hey, I need you down the tunnel, help me fix a water leak. This person would help do that. Also, he's got a background in construction and carpet. So a lot of that, we wouldn't have to sub out carpet anymore. Yes, we would still have to spend the money to buy the materials, but as far as subbing that out or hiring that out, we wouldn't have that big expense, I guess.
Okay. Sounds good. Okay, you go enjoy the mountains. We'll finish up the conversation.
You done with me?
Yep.
All right.
Hey. All right.
Thank you.
Hey, take care. Have a fun trip. Bye-bye.
Poor guy.
So we were trying to figure out ways to kind of kill 2 birds with one stone. You read about this probably in my last 2 Friday reports. Trying to find, to be real frank, trying to find during this time with finding anybody that wants to work part-time is about impossible. And so we decided, what if we bundle this up and make it a full-time position? We'll probably attract somebody. Attracting somebody part-time at this time is not. So we kind of challenged Dave to bundle it up. So, what are we adding? We're adding that CDL. We're adding that custodial fill-in. We're adding, I call them event managers, striping fields, emptying trash cans, and cleaning bathrooms after events. Somebody's got to do that. Like at basketball, putting sand down, putting salt down and de-ice sidewalks. There's just a lot to do. So we tried to bundle it up to knock out COVID and some of the other jobs. So that's kind of what we were thinking about there. So on the table for recommending to you is seasonal help, 20 hours as long as the season is, and then bundling some other jobs. I don't know if you attached the job description. I know you like to see job descriptions. There's a job description, and then bundling some roles and responsibilities all in one for a full-time employee.
Okay. All right. We've had a lot of discussion. Really good discussion. So before we move on to the action agenda, given that this is a thing
It's a nice break for people to get up and leave.
Yes, but really quick before they leave, any questions that have been unanswered or anything that we haven't talked about that the particular stakeholders in this room feel like we need to discuss before? Okay. I'd say if you are interested in staying for the action agenda, we'd love to have you, but understanding that people have other things they need to do, if you want to sneak out, this is a really great time to do that.
Thank you so much.
Thank you so much.
We'll be in touch.
Okay.
Well, okay. So on August 3rd, I'll probably bring an action item asking for approval for that, what I just described.
Yes. Yes. Okay. Does anybody need a break or anything before we just trudge right on? Okay. So let's move on to the action agenda then, starting with the instructional support program public hearing resolution.
I'm gonna go ahead and turn this over to Luke. He's been working on it.
So I talked to you guys last week about this, looking at, I was going to publish this meeting to approve this. However, it was a little more complicated. Had to get legal involved. They had to draw up all the resolutions for me. So based on what I talked about last week, this is really the resolution that needs to be put in place to move forward so I can publish into the paper for our public hearing for the next meeting. So
need someone to read the entire resolution, yeah?
Yes.
I move that the WG Board of Education approve the following resolution. Whereas the Board of Directors has determined that to continue the current level of services and to fund the ongoing programs of the school district, continuation of participation in the instructional support program for a period of 5 years is necessary and in the best interests of the district and its residents and students. And whereas the Board of Directors wishes to consider continued participation in the instructional support program as provided in Section 257.18 through 257.21 Code of Iowa, and whereas the authorization for the current instructional support program will expire on June 30th, 2021, and whereas notice of the time and place of a public hearing must be published, now therefore it is resolved. 1. The Board of Directors wishes to consider continued participation in the instructional support program as provided in Sections 257.18 through 257.21 Code of Iowa for a period of 5 years, commencing with the fiscal year ending June 30th, 2022. 2. The additional funding for the instructional support program for a budget year shall be determined annually and shall not exceed 10% of the regular total program district cost for the budget year and monies received under Section 257.14 Code of Iowa as a budget adjustment for the budget year. 3. Monies received by the district for the instructional support program may be used for any general fund purpose. 4. The instructional support program shall be funded by instructional support state aid and a combination instructional support property tax levied annually upon the taxable property within the school district, commencing with the levy of property taxes for collection in the fiscal year ending June 30th, 2022, and an instructional support income surtax imposed annually. The percent of income surtax to be determined by the board for each budget year to be imposed upon the state individual income tax of each individual income taxpayer resident in the school district on December 31st, 2021, and each year thereafter. 5. The Secretary is authorized and directed to give notice of a public hearing to be held in the Middle School High School Media Center in Woodward, Iowa on August 17th, 2020 at 6 p.m. Following the public hearing, the board intends to take action on the question whether to continue participation in the instructional support program.
Motion by Dave, I need a second.
Second.
Second by Troy. Can we get a roll call?
Ashley Grant?
Yes.
Lou Burris?
Yes.
George Yancy?
Yes.
Dave Elliott?
Yes.
Dan Turner?
Yes.
Good work in reading that really lengthy resolution. All right. So let's switch gears here and talk about some proposed legislative resolutions.
So you may recall, we talked about the legislative priorities probably around October. We just weren't aware. I mean, they come out. I'm on the job. I was aware, and so I got them out to you. And this would be, we were maybe a little premature, Dave. I think last year you went to the delegate assembly, and this is where these priorities kind of drive. So I think on my Friday report I said start thinking about the delegate assembly and talk to Ashley if you're interested in going. I think it's November 18th, if I remember correctly. I'm not sure what November is going to look like as it relates to the convention and some of those things, but I'll definitely keep you posted. So we'd really like to land on 3 or 4 of these priorities. I think Luke attached in the annotated agenda what we decided last year. You may just say, hey, what we decided last year is probably similar to what we want to do this year, or maybe you read through them. I shared them with you the last several weeks to kind of take a peek at them. I'd open it up to conversation.
So when I read through this, there was nothing I felt like that dramatically shifted my thoughts from last year's goals. I feel like they still ring very true today. So that's kind of my opinion, is we continue to put our muscle behind those things. Thoughts for the rest of it?
I agree with that. Our priorities last year, I feel, are still the same.
Yeah.
Would you just like us to submit? I guess I would need to.
Say that again.
Well, yeah, once you decide, we're more than willing to submit for you the
Yeah.
priorities. Okay.
Yeah. At least that's my opinion. If anybody else differs.
In practice, what happens is we're making a recommendation to the team at IASB. They prioritize it in the process of getting it to the floor for delegate assembly. And then our representative should vote yes on all of those priorities, but it's not like we're swaying a great deal.
Yeah.
It's basically saying like where we want them to lobby towards. Okay, so essentially we're just and I don't want to speak on anybody's behalf if they feel differently, but our motion would be to approve the legislative resolutions same as last year. Is that how we say
Sure.
it?
If you want to list them,
Okay.
so if you want to list them, so you can put them in. If you
What's
put it
that?
in
Yeah,
if in your motion, if you'd list them, so
just say
they're-
them out loud.
Yeah.
Okay.
I'll move that the WG Board of Education approve the following legislative resolutions for Woodward-Granger CSD. Dropout at risk, mental health, area education agencies, teacher leadership and development, and supplemental state aid.
Motion by Dave, seconded by Tim. All those in favor?
Aye.
Motion carries. Websites.
Okay, can you two jobs at once, Cody? Need to.
You got to get them on a mic.
Did we have any takers that sat in
So,
the presentation?
Troy helped me out. I don't know that you guys are seeing the top 3 proposals there?
Yep.
Okay, so I kind of had the 2 Troys that went through the whole process with me. So I had Troy and Troy Polito went through the process. And so when we were looking at these, we were looking for who was going to be the best. First of all, I think, Dave, you asked last time, do we need a new website? And that there's updates needed to our current website to just keep it safe and secure. And it was going to be upgrades anyway. And so what we were looking for, and a lot has changed over the years with our website. And they used to be an Iowa company. Now they're mainly an Illinois company with a little bit of an Iowa base. So as we were looking to move forward, we were looking, okay, do we want a template base? Do we want a full-on custom website? What do we want that to look like going forward? And how do we pick the best partner for us as a district? And we wanted, I keyed in on, I want a partner. I want somebody who's going to work with the district, and if we have an issue, if we have a need, they're going to be ready to help us solve that need. And so, Troy, I see you ready to jump in. Do you have any?
Basically, I sat in on it, and I wanted to, basically, is this program going to be user-friendly? Is it going to be more modern? Is it going to be mobile-friendly? Like our current one is not mobile-friendly at all. Between this discussion with Cody and Mr. Polito, the best option was between the 3 that we've had, and money-wise, if we stay with our current one, it was going to be outrageous.
Okay.
And it's so like there's 2 in that top 3. There's 2 that are very highly template based. They do have some custom options, but they were
one of the options they had was templates, and that makes you kind of cookie cutter style, and it's like, well, do we want to necessarily be cookie cutter? And then the extreme of that is full custom, so like everything's custom, which we had some anticipating like a full custom site might take up to a year to develop, and so that's another thing that we weren't ready for. The specific site that the developer that we're looking at, they have a short cycle. I think I might bump their cycle back a little bit. I think we were looking at the end of first quarter. They said they could actually have it ready by the start of school. I don't know that we want to change the site on the 21st of August and go forward with a new site on the 24th. I don't think I don't want to do that. So I applaud them for being that eager, but I'll probably push them back as we discuss that. But they seem to be right in the middle of that, full-on custom and template based. They kind of have the custom look, but at a template price. They work with a lot of, they're an Iowa company, so they work with several local schools. Ogden just launched a site with them. Pleasantville, I think, launched in the last year. And then a lot more southern Iowa schools are on their list. They're familiar with our school, which is our athletics scheduling platform. So we think that'll be easy to kind of tie our school in because they've already done it for other schools. So I guess looking at that, our recommendation is Neapolitan Labs. With a few, they had some extra customizations on there, just some social tie-ins. Those are that would be our recommendation is go with them because we feel like we're going to get that custom look, modern look, but it's definitely very reasonably priced.
I'm just looking at some of the sample sites here. They've definitely much more modern than what we have today. Yeah. I like their use of white space and they're good. Okay. Questions about their recommendation? You feel good about it?
I felt really good about it.
We trust your judgment.
I'll move the WG Board of Education approve the website for Neapolitan Labs. Second.
Motion by Sam, seconded by Tim. All those in favor?
Aye.
Aye. Motion carries. Seesaw purchase.
So I'm going to turn it over to Cody as well. During our conversations about the remote learning plan, one of the things that came up was, if we're going to anchor to Seesaw as our primary learning platform, we probably, it comes in different models. I think we have maybe the lowest level model, and I think to accomplish what we want to accomplish, we have to go up a couple models. So I'm going to turn it over to Cody.
Yeah, we've been on the free version, and maybe Christy can speak to this too because she's a user of it, and I don't know if Kendra is at all. Maybe not, but I know Christy is. The free version kind of limits and caps storage. It limits collaboration, so it's harder to get multiple teachers in the same classroom. Christy, what are some of the other things that maybe we're running up against? Jamie's probably the better one to speak to this, but.
My colleagues, we attended some different webinars that Seesaw held, and by doing that, we learned about, I can't think of the name of them now, boards that you essentially put on Seesaw that have learning activities for kids. And with the free version, you can only use one page. And many of those activities that have been created are multiple pages. So one of them that I had sent to my students was a patterning activity, and there were 10 different patterns on 10 different pages. And because we went through those webinars, we learned that there was a free trial of the premium Seesaw that they had released, I think it was at the beginning of April, and it went through the beginning of June, so that if you wanted to try some of these things, and everyone was doing online learning, you could. So we learned as a team a lot about the extra and additional features that you can have with premium. We collaborated a lot as a team. I know Amanda Masker created a lot of activities and was sharing them with us. She made videos to teach us how to use different aspects that we were able to get into because of the premium version that we trialed. And I know Amanda is a Seesaw pioneer, and I've started taking some classes to become a Seesaw pioneer, which is kind of like an expert on Seesaw. And then by doing that, the Seesaw community then opens up even more opportunities for you as a leader to experiment and play and teach others. So.
And part of the problem is we were on the free, and if teachers had already taken advantage of the premium, they couldn't get it. And so we actually tried to buy it as soon as March hit. We tried to buy it, and our salesman was too busy that we couldn't even buy it. So we wanted to finish the year with premium, and it just didn't happen. But no, it's something we thought about last year. So I mean, this isn't, regardless of this, we were already looking into Seesaw premium. So.
And is this a district-wide recommendation? Would middle school, high school use it, or just elementary?
So Seesaw is only, the numbers that are here, it's only for through grade 1. So it's for ELC, and then grade 1 is on here too, which is only 45 students. And so it would, 55. So at the $8 per student. Actually, no, I take that back. I said it wrong. It's ELC and elementary.
Okay.
I said that wrong. I apologize. I'm not looking at it.
No, you're good.
I won't scare anybody. It's pre-K 5.
Okay.
So it's been a few weeks since I put those numbers together, so I forgot.
Cody, you only do about 1,000 things, so it's okay.
He's still on whiplash from graduation ceremony this spring.
Do you have a sense of how many of our elementary teachers already use Seesaw?
Pretty much 100. I would say pretty close to 100% because we wanted them to use it last year. I don't know, as they got up in the grades, there was some choice with Google Classroom, but I think most of them got to the point where they had a presence on Seesaw. So
did we provide any staff development on Seesaw for them?
Jamie has in the past, and like Dr. Adams said, we're working on what's our name?
Instructional design.
It's getting a little late. I need a nap. So, yeah, our instructional design, we're kind of working on some PD right now, some self-paced personalized PD. So, yeah, we're hoping that by August 1st, we'll have that ready to go. We're working with the coaches later this week. Again, so we have a Seesaw flare and a classroom flare. But yeah, Jamie's done past PD, and we're looking to do future PD.
So the stars are aligning a little bit here. When we sat down and talked about the continuous learning or remote learning, the standard is going to be Seesaw, K-5 and Grandwood. Secondary would be Google Classroom. So they've designed a instructional design through Seesaw and Google Classroom. The law says that teachers, in order to teach remotely, need to be trained in remote learning, and one of the items that works is pre-service teacher PD. So if they put together a great piece, they're going to expect it. If it's not 100%, it will be 100% because that's the standard that we've established for a remote learning plan. So we need to coach everybody up.
I'll move the WG Board of Education approve the purchase of Seesaw in the amount of $5,486.04 paid for using Pebble.
Motion by Sam, seconded by Troy. All those in favor? Aye. Motion carries.
Then turn the EMC renewal over to Luke.
So Dr. Patrick, he's our insurance rep for property casualty. So you can see we did have an increase over last year, large in part based on property value for buildings, same as last year. That's what the biggest jump was from last year. A little bit of an increase on the auto premiums. Best part of that was workers' comp didn't increase at all. You remember we did have some comp conversations with EMC about watching our numbers, and we didn't see an increase there, so that's a huge one for the district. So this is something that's paid out of management, and just like all other insurance. Usually there's a big increase. Patrick was anticipating 15%, but he's happy to see it came in at 10 based on some of the things that we had to grow this year.
Move the board, WG Board of Education approved the EMC insurance renewal in an amount of $229,322 for the fiscal year 21 school year paid by Woodward Management Fund.
Second. Motion by Tim, seconded by Dave. All those in favor?
Aye.
Aye. Motion carries.
So one of the tasks I asked the principals to do before they disappeared on me, and quite frankly, they haven't disappeared at all, obviously with the summer that we're having, but one of their tasks was to make sure that the student parent handbook edits were made so I could bring it to the July board meeting. And so I believe you have a link to each of the handbooks. Let's do a quick whip around and talk about the edits maybe that you made. We'll start with the high school and we'll work our way down. So Rob, if you could kind of share what edits, if any, you made on that handbook.
We didn't make any edits. We cleaned up some language. Just some typos that were missed when we've gone through it before, but we didn't make any changes.
Same. 2 years ago, we had the one handbook, and then last year we went away, so last year we completely read it for the most part, so, and very few edits still.
No policy changes, we just changed the staff page and the dates and the year, and other than that, it was
Heavier lift last year, it sounds like. Becca?
Not too many changes, we just added no steel toe boots.
Great edit. Good one.
We learned that the hard way.
If you have any policy changes that come up because of COVID, how do you plan to handle that?
That should be policy changes and content.
Well, they'll definitely be in the staff handbook, and Kendra and I will look at that. I don't know if there's any, if you make reference to board policy in your handbook, you want to change those. We can certainly do that on a admin Thursday morning.
Yeah.
Kind of go over what board, we're going to talk, and maybe it'll strike a chord with you tonight as we go through some COVID-related board policies. If you reference particularly on some of the leaves for staff.
I don't think we have anything that would be specific. I mean, it's student conduct that's tied to board policy. Dress code, I don't believe that will change, except maybe the adding of face mask if we make that policy. And I think attendance, that's going to change based on if we have options, or what do we do with those parents. I don't think it'll change our unexcused absence policy or how we interpret that. That if a student says that they're going to attend school, then they don't show up, and then they choose the online, or if an online option were available, we would follow through with that. We wouldn't eliminate our policy. We'd want to know what their choice would be communicated.
I guess I would just ask that if we have a board policy that changes something in your handbooks, what would be the plan to communicate that to students and parents?
I'd probably just take that section, then if we campus that out to everybody impacted, here's what changed, here it is, we'll get it here. Updated.
Do we need to put some sort of caveat in here, and it could already exist, that says board policy trumps whatever's in here? In the event that something changes, I would just hate for somebody to think that this.
It's kind of a rule. When you look at the hierarchy of.
Here's something in place right now. The state had said that they had wiped away with the passing requirement to pass classes in order to compete in fall activities. We didn't add that to the handbook. That's just something the state has said.
Sure.
We're going to do away with that. We can go back and edit that if that's what you would like.
No, I don't think that's what my ask was. I just want people, and maybe if it's implied, then that's good, that just people understand that board policy, if it changes at board policy, if it doesn't get updated in this document, board policy still prevails. And so maybe that's implied and we don't need to put it, and I'm okay with that.
Yeah, I think it's probably a mechanism that I need to put in my admin meetings following a board meeting. You know, I could probably do a better job of saying, hey, administrators, these are board approved. These were board approved, second final reading, immediate implementation. How does that affect handbook? How does that affect, you know, and just do a better job, and then communicate out if we need to. I will tell.
For me, it's not so much the changing the text, it's communicating out
Right,
to the patrons.
right, exactly.
This is a change.
Yep, exactly, and we owe it to them. I will tell you that I don't do this unilaterally. Anything that's related to nursing services has been vetted through the nurses. Anything that's related to athletic, I asked Matt, is it still accurate and still correct? And same with principals. So they should be in the know, but we'll be a little more deliberate about ensuring that that doesn't happen.
And there's on our front page, that last paragraph talks about the school reserves the right as we modify and change district policies, that it could change, and we would just share that out.
Thank you.
I move the WG Board of Education approve the student parent handbooks for the ELC, elementary, high school, middle school, and graduate for fiscal year 21 school year.
Second.
Motion by Troy, seconded by Sam. All those in favor?
Aye.
Motion carries.
So now you'll understand why I kind of stalled out, because I swore that was an action item earlier in the conversation. So I have maybe a little graduation jet lag as well.
You're okay.
So item G is what Dave was talking about on the phone, packaging multiple little jobs together to make one full-time job to attract a better candidate. Say that again. The seasonal?
That seasonal is separate.
Yes, it's separate. Yep.
Funding mechanism for this general fund.
Yes.
I move the WG Board of Education approve making the maintenance grounds position one full-time employee.
A motion by Sam, seconded by Troy. All those in favor? Aye. Tim, you gotta be quicker on the draw.
So under H, you've seen all of these policies at second reading. I would draw your attention to Roman numeral 4. Dave asked me to kind of rework it. The first sentence, if you recall, I reworked it. It sounded good, Mindy, and then I continued to read the policy and I said it again, and there was some redundancy. So quite frankly, I took that first sentence out and just started with expulsion as a tool, as I kept trying to rework it, I was just saying the same thing and said in another paragraph. So I thought, I'll just take it out. Still makes sense, has the context. If you recall, that was kind of I think it said the board is the only one that can remove.
I was never worried about the intent, I was worried about it being used against us.
Yeah, well, it's gone. So that would be the only thing that changed since first reading.
I move the WG Board of Education approve the second reading of board policies 411.3, 502.6, 502.7, 503.2, 503.3, 503.3 R1, 503.3 E1, 503.4, 504.6, 505.1, 507.2 E1, 507.2 E2, 507.8, 603.3, 605.4, 607.2 as presented.
Second.
Motion by Tim, seconded by Sam. All those in favor?
Aye.
Aye. Motion carries.
So I've got a few new policies in front of you, so I'll take them one at a time. 409.2, which is employee leave of absence. That's kind of a one-stop shop. as soon as we get this approved, I will actually be asking you to rescind a 414 series where they're all broken out for the classified. I talked to Siobhan earlier this week, and I said, help me, what have you done here? And she said, well, we're rescinding the 414s. We're putting it all in one spot. And the reason they're doing that is with, the Family First Coronavirus Response Act and everything else going on, they felt like just kind of bringing that one-stop shop board policy outlining the different leaves for both licensed employees and classified made it quicker to get to some of those resources for the employees and whatnot. So 409.2 captures, I had Brandy go through and make sure that it matches the handbook and anything in the master contract. So it should be all matched up. 409.2E1 talks about Family First Coronavirus Response Act, and then the 409.2E2 is about that FMLA leave that I was kind of talking about during my presentation. So that group reflects the leave opportunities for staff beyond what you as a board give them due to coronavirus. 501.9E1 is that remote learning request. Now, as it stands, I left it as drafted by the Iowa Association of School Boards, and it talks about documentation from a physician. That could not only be the child, but it could also be you have a sibling in the home or a family member in the home. I think what I would ask the board, I think we need to talk about, do we widen that a little bit, considering the governor's proclamation saying, and that's, if that was letter A, if you recall those 5, letter A, a parent that requests remote learning, I guess I would ask the board, how wide do you want the gate to swing open on this one? And I can capture that in that policy. Do you want to limit it to just health concerns, or we're required to provide this remote learning for medically fragile. That's a requirement. We're not required to offer that to others, but in the proclamation it said, so I wanted to have that conversation with you.
So I'm open to offering it to others. I think I have a couple questions about it though. One would be, can they just opt in and out whenever they want? Do we need to put some sort of?
Yeah, yes, no and yes.
Okay.
Yeah, no, we don't want to, because you heard me talk tonight that a great strategy we could have would be, hey, Christy, why don't you take the remote learners, there's 15 of them. I don't need those 15 to say, oh, hey, it looks kind of fun, we're missing out on a lot of fun, I want to come back to school. I think you'd commit to a minimum of a quarter, if not a semester. If you chose to do remote, yeah, I think you'd commit to either a quarter or a semester. I guess I haven't really decided on that, but you definitely commit to a longer.
Maybe with some sort of out clause if both parent and the teacher determine that it's not working for whatever reason.
Absolutely, we want to evaluate that.
Like the superintendent approves or something.
Just like I would love to have the conversation for opting into it. I'd like to think that maybe there's some conversation with the principals before they fill out the form and submit. I'd like to believe, hey, what are your concerns? How can I walk you through those? And maybe they'd go, oh, I misunderstood. I'd rather be in school. So I'd really like that touch before they opt in, and probably an evaluation to opt out. Absolutely,
And then, do we have an enrollment deadline? Like, they can't do it on August 23rd. We need it on a specific.
I just love how you give me these little softballs. So I would propose that on our special board meeting on August 3rd, second and final reading, immediate implementation, we'd have that week for families to apply through this form. So August 7th would be the deadline. And obviously before we approve it on the 3rd, we can communicate that. I mean, they're listening right now. Hey, there is an option. Tell me more about it. Call your principals, talk to your principals, and then after second and final reading, it's implemented, give them the week, and then on August 7th, we can kind of get a sense of how many are wanting to work remotely. And then I think that allows your BLTs to really zero in on how do we want to respond, based on all of that. Does that make sense?
We got a clear, definitive answer from the state on funding for online students?
Dave, I wish I could say yes. I wish I could say that it's We were told as of Friday, it's not in writing yet, but it sure looks like if you follow A, B, C, D, E, you're okay. And this would fall under A, parents making that request. So I'd like to believe that there's solid ground there.
How many do we think that possibly?
I've thrown out the number 15%. I don't have any, just in talking to families and thinking about, different school districts that I hear from. I hear anywhere from 5%. I've heard clear up to 20%. So I'm just kind of using 15% in my head. I think Ashley and I kind of had that conversation. It's one thing to, think about it, and it's another thing to say, okay, what do I really want to do this fall with my student? I'd like to believe that based on, just my conversations with families, we had a parent threaten to park their child from 8 to 3 in our parking lot if we didn't open up schools. And I know they're teasing, but I hope they're not listening. But there's a sentiment that they want their kids back in school, and I think you've all heard that as well. So I think we can accommodate and respond to the folks that don't feel comfortable or have something going on health-wise that they just don't feel that in-person learning is the right thing for them.
I know we've talked a little bit about grade level at an elementary student opts for online learning. And we hit a high enough threshold, we can dedicate one of the grade level teachers to that online.
That's my goal.
What about at the secondary level? How are we going to handle that? Are we going to put an added burden on the classroom?
Well, I think then it goes back to what our amazing instructional coaches have done. Let me teach you how to do this thing once and be efficient with it, so you don't feel like. So then it would just be, maybe you have 2, 3. Each of you have 2, 3 kids learning remotely, and your responsibility is through your instructional design to cover all your bases.
But that's not necessarily
I know
a small thing when you're
no, it's not.
full-time
It's not. No, it's not. And I certainly don't want to oversimplify it, but I have a lot of faith that I watched Mindy's eyes light up when she started talking about this part, and I think we can do some things with our teachers to make the lift a little easier. I really do. I really believe that. And then they'll
As best
support.
we can, honestly, Dave.
And if somebody doesn't feel that way, I know Mindy will go right in their room and say, get knee to knee and say, let's do this together.
And I'll say, what? No.
My concern is, I would definitely like to have them meet with the principal, because there's going to be some students that are behind already, and they're going to get even further behind. And I also worry about, like we say, child abuse. You know what I mean? That's something that we need to take a look at. But I think the principals and the previous teacher and the incoming teacher all need to be involved.
And we can certainly say that as part of the request process, meeting with the principal. We can certainly do that. So widen it a little bit, is that what I'm hearing? You're okay with widening it for everybody to request with meeting with the principal and
I think I am. I think and I don't mean to push the buck back on the principals, but I really want these parents to have an understanding of what the expectation will be if they're doing that. And so maybe in that conversation, and if it's not the principal, maybe it's a member of the BLT, or maybe it's a grade level representative who can really just talk about, okay, if you choose to do this, here are some really clear expectations about what their life will look like being an at-home learner.
it's required this time. This is not
Yeah, so I just
voluntary education.
I want them to really understand what that looks like, and maybe that's a conference with somebody.
My only exception is in the grade levels that it's not required. Preschool.
Compulsory attendance age.
Beyond half day,
Sure.
4-year-old preschool. If we have a bunch of 3-year, because I have gotten a few emails from 3-year-old parents and some full 4-day parents that have said, hey, we're just going to kind of hold off for another year.
Yeah.
When they're little. Absolutely, the half day 4s on up, yeah, I think that's.
Yeah, I think so, because I just really want parents to, and I support parents that feel like it's their need. I just really want them to have a very clear picture of expectations, need, guidance, all that.
Well,
Yeah.
this kind of segues into something that one of the conference principals sent out, and I'm going to discuss this with Jake a little bit about open house. and having a discussion, having people meet, and then really going through and answering some of those questions that they might have so that they can make a better informed decision that, this is what our plan is, this is our site plan, to kind of calm some of those strategies down, and what we've gone over here in the board meeting. And then, if they want to talk about remote learning, talk about those expectations so that we can get those questions answered on a larger scale. But we talked about just, what's open house look like right now, and do we do it by grade level? Do we do it, 6th grade's over on this part, 9th grade's here? Well, what do we do about parents who have multiple students? Because I think some people will have all those questions. So when you're talking about making sure they have an informed decision, I think that's some of the things that we were just kind of brainstorming with the other conference principals as we're going in to start the year.
I think it's a great idea. My question would be, does that align with potentially the August 7th date that we're throwing out?
So we just have to look at, again, with our VLT, I already sent an email out saying we need to meet to discuss these things, and if we can meet, organize and discuss and have something prior to that due date for parents who are interested in discussing or coming in a safe environment to talk about.
And my point is, and maybe we're going to get guidance from the state on this, but if they're going to choose to do in-home, could they participate in activities?
I got that word at the conference Wednesday.
I would say my assumption is yes, because they're still required to meet the same learning standards, but I don't know that for sure.
I will tell you it was yes until my Zoom meeting today. And then it was, we're not sure. I felt very confident in your yes, and I appreciated seeing in your notes, because that's what I heard last week. And then today from the Department of Ed, I heard, we're not sure, we'll check into that. I'd like to believe it's a yes, because you would be enrolled as a student just like any other student. Just your learning platform is different. Welcome to my life. This is what I've been doing since March 17th. So I do believe it's going to end up yes, but we were told today that it's not a hard yes yet. So.
It's a soft yes.
So I'm supportive of this with those kind of modifications.
Yep, I've got notes, and I'll kind of redraft it and have it for you the next time. I'm going to talk about an easy one, 604.11, which is appropriate use of learning platform. Very similar, like an appropriate use of technology, basically saying don't abuse it, don't use it inappropriately. Pretty standard. 501.9 student absences. All that did was add in the remote learning as part of COVID. So some of these, and I feel bad, we approved school day in 2 months ago. I have to bring it back to you. Obviously I was getting through mandatory policies and we were doing great. They changed this one to reflect that remote learning as part of COVID counts. And so there's some language you'll notice. I think I use bold text whenever I add text to our current policy. So it basically just talks about remote learning and those days counting as for students as well. And then lastly, two that we need to have one we need to have a conversation about, 907. 907, which is district operation during public emergencies. Again, I always pick the more, give them the authority more to the board, so you can see there was kind of a this or that. Talking to Tim and thinking about what the kind of guidance we're getting, I think it does make sense to give me the authority for a closure for 14 days. I love what Dave said, you need to be accessible, and certainly I'd be on the bat phone saying, hey, just got off the phone with Dallas County. They're telling me I've got to close for 14 days starting tomorrow. But trying to get the gang together and get board approval on something like that might be a little bit difficult. So I would suggest changing it to superintendent for 14 days, board action for anything longer than that. That'd be my recommendation based on what I'm learning the last 48 hours. If you're okay with that. Yeah. And then 907.R1, two things that I would point out. One, I'll put our mask language in there based on what we talked about today. And then also you'll notice that with community use, I did pick the one that talks about them supplying, again, a safety data sheet on chemicals, but you know what? Bring your own, clean up after yourself. So we are insured to make sure we have what we need to take care of the students, and that's during community use, facility use. You see the or there? I took out the one where we're gonna use our stuff and asking the renter to use their stuff. So masks, K-12, masks, adults, masks, K-12 required, and bring your own bring your own cleaning supplies, community use for 907.R1. I'd add that to it for next time.
I am supportive of that. How do we ensure that that is happening appropriately, that they're utilizing the appropriate stuff?
Well, I think we've got a great one to the learning one. We had a church, you know, and it was a sit down. I mean, we just kind of sat down and walked them through that. And I think Matt, I think does the lion's share of the heavy lift on that. I think it's a conversation. Hey, you want to use our facility? Great. Here's how it's going to go.
Just wonder if we maybe update the contract with the language so it's.
We need to. We haven't. We need to.
Yeah, so that they're signing off on.
Yeah, there's a facility use form.
Yeah.
We'll put that in that form. Yep. I'll bring that all. I just wanted to test the waters with you before I got that far down the road. If you want me to go that direction, next time I'll bring it that way in the facility use form with that language in it. Other than that, pretty straightforward. Like I said, all of that reflects handbook and contract. But I'd be happy to answer any questions you might have on any policies I didn't talk about or question.
I move the WG Board of Education approve first reading of board policies 409.1, 409.2, 409.2E1, 409.2E2, 409.3, 409.3E1, 409.3E2, 409.3R1, 409.3R2, 501.9, 509.E1, 601.2, 604.11, 907, 907R1 as presented.
Motion by Sam, seconded by Troy. All those in favor?
Aye.
Aye. Motion carries. Consent agenda. Almost there, guys. Sam reviewed bills this month, said there was.
Everything's fine.
Everything's good.
Good to me.
See, we've made a few hires. Do we have any outstanding positions yet to fill?
We're still struggling with custodians.
Yeah.
ELC. We're still struggling with the bus driver for Mike Ramsey's route. I think that's it. Correct me if I'm wrong.
I will say, there was a recommendation for the head volleyball coach that did not get put on here. I don't know if we can approve that. I do have a recommendation from Mr. Eklund, but I don't know if that has to wait until next meeting.
We do it on August 3rd. Let's do it then, just to be safe.
Has Mike Ramsey been asked if he would continue the route until position filled?
So, Mike, I love Mike. That guy, he's still ushering buses around for us. I mean, it's July 20th. He was in the office today. I can call Mike and say, can you get 5 to United Body? Absolutely. Mike talks in future tense. And so I wonder. I'm going to wait because, you know, love the guy. He's earned it all. He said he's been getting up at 5 a.m. since being a kid on a dairy farm. And he doesn't want to get up at 5 a.m. anymore. And I get it. And so I may get more desperate. And I may go back to him, but no pressure, Mike, if you're listening. We're playing with some ideas, so I'm not nervous yet. But who told me they drove through? Oh, it was I don't know if it was somebody in here or somebody said they drove, oh, I think it was Tim. It was actually Tim, said he drove all the way up to Minnesota. And every school district he went by, that bus drivers needed. I mean, it's, you know, I'm really excited. Candace is, I think she's testing on July 31st. Candace is testing or busing on July 31st. You heard Dave talk a little bit about him getting one. It's going to be a requirement for different positions. We're building our pipeline. We have to build our own pipeline. They're not out there. So we'll continue to put energy in building our own in-house.
I move the WG Board of Education approve the consent agenda as presented.
Second.
Motion by Troy, seconded by Tim. All those in favor? Aye. Motion carries. Other matters, we're meeting on the 3rd.
I did, well, I've got a drafted letter ready to go out about 11 p.m. tonight, probably, as soon as my computer gets a little more battery, and I did say Woodward, if we want to do in Woodward.
Sure.
That'd be okay.
That's fine. Yeah.
And we'll be in Woodward again on the 17th, but it's either be here twice or there twice, let's just go to Woodward. So let's plan on August 3rd, 6 p.m., Woodward, High School and Middle School Media Center, special board meeting.
I did have some people asking about back to school nights and what that'll look like. Admins, have we talked about that at all, or is that on radar yet?
Something we talked about today, of what our feelings about real day, we bring in all the moms. I know I'll get a lot of sixth grade parents to come in, probably not a ton of others.
Just what it would look like. I mean, that's what the discussion would be. Not that it hasn't been in your mind, it's just on the list, it's kind of down there.
Sure.
And I think once getting through this meeting, learning, making some decisions, I think that frees up, what we want to do, what part of the buildings can we use, can we have 2 different grades in there, is that going to be too many? So that's just some I know that we've talked about.
No pressure, I just know that I'm guessing some parents that are watching this today are wondering if they're going to get to
You
bring
would
other
obviously have
people's
to
stuff.
modify it in some way.
Yeah.
To manage. I mean, look at what we experienced just yesterday as part of graduation. It's going to have to look a little bit different.
Yep.
But I would challenge to say, I think there's purpose in that activity. And so if you can't do it the way you want to do it, how do you accomplish the goals for why you had that activity to begin with? And can you accomplish it a different way? Might be more personalized touches. Maybe I'm just spitballing here, but.
Okay, anything else? Need a motion to adjourn?
I just want to say thanks for everybody showing up yesterday. I appreciate your involvement. I mean, I know the seating wasn't ideal, but like we talked about, what normal is or what we're moving forward and what things look like. I don't know necessarily the new normal, it's just things are going to be different. And so I just appreciate everybody's flexibility. So thank you for coming. It was nice. And I will apologize to you publicly for forgetting about the Pledge of Allegiance.
You cut my part out.
I looked at my notes and I didn't bold it. And if I didn't bold it, I don't. Usually I put everything that happens on a different page. And so I didn't bold it, and I was like.
I told Ashley, as soon as you started talking about individual kids, I leaned over and I said, I think he forgot you.
I will say, I'm so glad we got to do that, because why we do this is so kids can get there. Yeah. And so it's one of the most rewarding parts of this job for me, is to see those kids walk across that stage. So I was thrilled to be there, happy we were able to put that together.
Yeah, it's great.
And I think out of this comes some new traditions.
For sure.
I mean, it was amazing, and Cody may agree or disagree, but those car rides, I mean, obviously, we're not going to put Mr. Chapman in traffic and where we go, but going to and seeing all those students and then them being there and wanting to do that, and kudos to the staff and that last day. We've never really had a last day where we send the seniors back to the elementary. However, it was nice that some elementary teachers came to the parking lot and were able to listen to the kids honk their horns as they drove through. I think that there's some positive things that are coming out that we can look at starting some new things moving forward. So I just appreciate the flexibility, and it's really, for me, it was nice after it was over because it kind of wrapped up the year, and now we can start really spending a lot more energy on the year upcoming. So thank you guys for that.
Thank you back to you, because what normalcy we can have, we need to have. So I appreciate the fact that you went to all those efforts and met the kids and still held the big ceremony. So thank you.
Yeah, you're welcome. I mean, it was my pleasure. It was fun. I mean, it was a learning experience.
Yeah, for sure.
We cover a lot of ground. Our district is large, and then to go all the way to Pella, that's a whole nother ball.
Our footprint is big.
Yeah.
That was a long drive. That was a long day.
Okay, let's do this. Need a motion to adjourn?
I move that the meeting adjourn at 10 o'clock p.m.
On the dot.
Second.
Motion by Sam, seconded by Troy. All those in favor?
Aye.
Aye. Motion